Namaskar, Swagatam, welcome to all. Expert on the dice, expert of the dice, but everybody is expert. Respected Agnihotri sir, Namaskar. Today's speaker, Dr. Sanjay Kadimatti ji, welcome ji. And all the audience, senior expert in the audience, welcome. Today, we are achieving our milestone of 473 in these 30 months. So, in average, every alternate day, we have been able to conduct webinar due to your cooperation, guidance, mentorship, and contribution as speaker or audience. Thank you. Thank you very much. We are grateful to you. We had decided to celebrate every day with our Ayurveda and Ayush. And in the series of everyday celebration, we are today celebrating World Osteoporosis Day because we do have various remedies in our Ayurvedic system or Ayush both. So I would like to request Professor V.K. Agnihotri ji for his initial blessings. Welcome, sir. Welcome.
Thank you, Dr. Pawan Sharma ji. Namaskar and good evening, everybody. And our respect to all the dignitaries and all the guest speakers. We, on behalf of our own and on behalf of IRES, we welcome you all, especially our guest speakers who are going to ornament today's webinar this evening are Dr. Sanjay, Dr. Karthika. Two speakers are the main one. I feel that osteoporosis in general that usually of the menstrual blood loss, females are usually more affected. So the special care is to be taken off in terms of the diet, calcium intake, and its proper metabolism. So banana, makhana, milk is the essential item. They must be there in the female's diet especially, though they usually avoid it. But what I feel that osteoporosis, if it is avoided or if it is diet out of the diet intake proper, it is not going to take place, say, up to 50 years of age. Even onwards also, if the quality diet is taken by the females and everybody. But what strikes in our mind is the osteoporosis problem leading to the individuals towards the senile changes or in the advancement of the age. So we can infer an impression that out of the Sapta Dhatu, Ras, Rakta, Mas, Med, Asthi being the fifth Dhatu, then Majja and Shukra. And Majja is equally important where inside the bones. So bones are repaired and manufactured by the calcium and vitamin D. So, and Shukra Dhatu has not got that much of importance or need to the body in that way. So, the Asti Dhatwagni and especially Mans Med Asti. Mans Med, these are Dhatwagni are to be taken care of during the taking diet itself. So our guest speakers are going to enhance whole knowledge pertaining to this subject, how the osteoporosis be avoided or what may be the best remedy from our side, means our Ayush side and especially our Ayurvedic side. So with these means initial words, though the percentage, data presentation, these all will be there with the guest speakers presentation. So with these initial words, I congratulate you all and wait to know much more the knowledge which you are going to give us all. With these words, I refer back Professor Pawan Sharma ji this platform for the further proceedings. Thank you. Thank you, Dr. Pawan Sharma.
Thank you, Agnihotri sir. Thank you very much. Now I would like to request Professor K.K. Dwivedi from Varanasi for his initial blessings. Dr. K.K. Dwivedi sir. Am I audible to you, Dwivedi ji? Welcome.
Namaste to all.
Namaskar, namaskar, swagatam.
This topic taken by this group, this audience, these listeners is very important at present perspective. Approximately 70 to 80% joint disorders are coming under this purview. Either maybe LBA or maybe OA or some other type of typical pains. I feel that this is very important topic, and the speaker of today will highlight the Ayurvedic concept on this. With this, I welcome and I congratulate the speakers of today and the organizers. Thank you.
Thank you. Thank you, Dwivedi. Thank you very much. Now, without wasting much time, now I would like to request Dr. Sanjay Kadimatti ji, Principal from Vijaypur Ayurveda College, VLE Day AVS Ayurveda College. I would like to request him first to explain the broader name of the college. We are unable to. Please, welcome, Dr. Sanjay.
Yes, sir. Thank you very much. I hope I'm audible and I share my screen. Yes, sir.
Yeah.
Slides are visible full screen, sir?
Yes, very good.
Yes, sir. So this BLDEA stands for Bijapur Lingayat District Education Association, sir. It is a 112 years old association, started in 1910 by three great luminaries, Dr. P.G. Halkatti and Swami Bantanala Swamiji and B.M. Patil, sir. And it has around more than 80 institutions, including from UKG, LKG to medical, pharmacy, Ayurveda, and nursing, MBA, anything you want, all degrees are there. And it is a 112 years old institution, and we are very blessed to work under such a great leadership of the present President, Dr. M.B. Patil, sir, who was the ex-Home Minister as well as Water Resource Minister of Karnataka. He has created water revolution in the state, because Bijapur was once a very dry, drought hit area like Rajasthan and all, very sunny. It goes up to 45 degrees in summer. But now it is much cooler and much greener, thanks to our beloved President, sir. So this college I'm representing today, and as it is a World Osteoporosis Day on October 20th, and both of my PG and PhD topics are osteoporosis. In Jamnagar, I did PhD. It is, I think, the first PhD on osteoporosis under the able guidance of my guru, Professor Harimon Chandolaji. And today I'll be, with his blessings and with all your blessings, seniors, I'll be presenting my topic. So today is World Osteoporosis Day, and the theme of this year, you all know, that is a step up for bone health. So healthy aging, as Ayurveda is the only science that deals with Rasayana. No other science in the world deals with this healthy aging. It is a dream of every individual. And the old age related degenerative disorders cannot be prevented, because there are some Swabhavika Vyadhis in Ayurveda. They cannot be prevented, but they can definitely be delayed by the proper and logical use, timely, Purva Vaisi Madhyeva, that Rasayana use can be used for delaying of the aging. Vikaro Dhatu Vaishamyam is very clearly told by all the Acharyas, and Vaishamya Chakrapani beautifully classifies as either Vriddhi, Rasa or Gramana, that is Deshantara Gamana, that is Asha Apakarsha Hetu. So today we are discussing about the Rasa of the Dhatu, that is the Kshaya of the Dhatu. So as told by Agnihotriji that it is the fifth among the Dhatu and it is very much blessed with a function of Sharira Dharana, strongest among all the Dhatus. It is this Dhatu which gives shape to the body. We cannot imagine the body without bones. It would have been a bolus of soft tissue, shapeless. Hence, Asti edifies bars on which framework man stands tall and handsome. I will not take much time for this because I have to much discuss on the management as well as the concept of Astikshaya, pathogenesis and treatment. So these all concepts, As plus Tin Dhatu, that means it is very beautifully said, to stay. Asti has been taken from the Nirukti root. As plus Tin Dhatu means to stay. Logic is very simple that even after the death, the only tissue that stays longer, if we bury or if we burn also, that is Asti. All else gets degenerated and decomposed, but bones stay for a long time. That is why this has been given as As plus Tin Dhatu means this stay. And Kshaya is a Kshiyate, we all know that is decrease or diminution. And some people call it as Asti Saushirya. Shushirani iti Randrani is the commentary of Chakrapani. That means Randras are pores. That means osteoporosis was not a new term to the world. Obviously, Asti Saushirya and Asti Kshaya were given thousands and thousands of years ago before even the modern science conceived that the concept of osteoporosis was there very much in our science. So penia and porosis are the two conditions of bone. Penia is just lack of bone tissue or the bone cells, and porosis is severe loss of bone tissue leading to the pores or becoming the brittle bones. WHO in 1994 defines this as a skeletal systemic disease characterized by the low bone mass and micro-architectural deterioration, especially in the lumbar spine as well as in the anatomical neck of the femur. Wherever there is a more spongy tissue, there is a micro-architectural deterioration which leads to enhanced bone fragility and high risk of fracture consequently. If everybody is wondering whether people die more of heart attack, stroke or breast cancer or any other cancers, but if we see here, the highest incidence in the world is almost more than 3 times than any other heart attack, that is bone fractures, that is osteoporotic fractures. More than, it is 12 lakhs per year if you see the annual incidence in the world. So the lifetime risk for women is 30 to 40%, and in men it is 13 to 15%. Women are high risk because they are naturally having the less bone architecture compared to men, and also this risk increases after menopause, which is called as the physiological transitional period of hormonal imbalance. And the female and male ratio is approximately 1:4. So osteoporosis, if we consider here, we should definitely consider one of the basic concepts, a Siddhanta of Ayurveda, that is called as Ashraya Bhava. When we say there is no disease like Astikshaya, it is a Lakshana told as a Dhatuksha Lakshana. And Astyashrayanam Vadinam, there is a Panchakarma, it is given on the concept of Panchamahabhutas as well as the Dhatus and Doshas. But Tatrastanisito Vayuhu Pittam tu Svedaraktayuhu Sleshma Shesheshu Yadekasya Tadanyasya Vardhanakshapana Asti Maruta Yornyaiva. That means my cursor, I think it's visible. Asti is inversely proportional to Vata and Vata is inversely proportional to Asti. Clearly, in Vagbhata it is told Asti Maruta Yornyaiva, means Asti and Vata doesn't behave as a direct proportional, it behaves like an inversely proportional. That means if Vata is increased, Asti Dhatukshaya takes place. There is no direct mention of anything like a disease in our classics, but on the principles of Ashraya Bhava, we take this. Hence, the Nidanas of Vata Prakopa, indirectly or directly, are considered as the Nidanas of Astikshaya or Asti Saushirya. Apart from this, I am very much thankful to my first guru, that is Dr. A.I. Sankal sir, because we took almost 3 to 6 months to frame the pathology during our PG and PhD, because one shloka is stored for Astikshaya, there is no details. But apart from Vata Vruddhikara, I'll try to explain logically how Medava Shrotas, Shrotas Dushtikarana, Astiva Shrotas Dushtikarana, Majjava Shrotas Dushtikarana, as well as Purishava Shrotas Dushtikarana are the reason for Astiva Shrotas, Asti Kshaya. These are the Nidanas of all Aharaja, Viharaja, Manasika and Anya. It was framed during my PG and PhD studies. So all Vatavardhak Nidanas like Shushka Shaka, Mamsa, etc. and excessive Vihara also. Manasika Vikaras like Chinta, Shoka, Bhaya, as well as Abhighata, Javar, Vaidyakrita, Marma Abhighata, etc. can be considered. And lastly, Kala, aging is one of the physiological reason for Astikshaya. Medo Ashroto, Dushti Karanas like Medyahara Sevana, Varuni, Avyayama, Divasapna. Nowadays, modern science telling that if you are driving a sedentary lifestyle, you will definitely lose bone mass. And if you exercise regularly, the bone mass is gained. That means Medo Ashrotas is also definitely having a role. Astiva Shrotas, Vatalahara, Vyayama, Ati Vighatana, Sankshobha. And Majjava Shrotas, because Majja does the Purana of the Asti, it is Parasporopa Samstabdha Dhatu Sneha Parampara. That means they are mutually helping each other. So if Majja is also lost, there will be more Saushiryata in the Asti. And Purishava Shrotas, I'll definitely discuss in the discussion that Sushruta, while explaining about the Vishavegas, clearly and beautifully mentions that Ya eva dhara Purushadhara sa eva astidhara kala. That means Purushadhara kala and astidhara kala are one and the same. And even to everybody's surprise, even modern embryology says that the skeletal tissue as well as the alimentary tract are formed from the mesoderm of the embryonic membranes. That means both are having the same, the potent cells, that is the basic cells, they are coming from the mesoderm of that one. That means even modern science says that if the absorption of minerals in the large intestine is not proper, then definitely there will be lack of calcium and all. That means large intestine, Purushadhara Kala and Astidhara Kala are definitely having a relation. It is a point to be thought over. Risk factors as per modern science, of course, female gender itself is a risk factor because they are having less bone density as compared to the men. Advanced age, menopause, surgical menopause, radical hysterectomy at the early age, history of fractures in adults and history of fractures in immediate relative. See, Vata Prakopa and Astikshaya we told as per the Ashray Bhava, and even modern science agrees that if there is a low body mass index less than 19, obviously everyone understands now, body mass index less than 19 is which Prakriti? It is Vata Prakriti. Hence, people who are having less body mass index will be high risk of osteoporosis. Caucasian race, that is white Americans of Asian origin, low calcium diet, low magnesium diet, smoking or tobacco in any form, excessive use of alcohol, lack of exercise, and astronauts who live against the gravity for more days, they also tend to lose bone density because of lack of gravity. Pathogenesis of three types, either failure to achieve optimal peak bone mass, that means if you are not getting the peak bone mass by the age of 25 or 30, then there is one of the risk factor. Increased bone resorption. There are two things in the bone formation and bone resorption. So increased bone resorption and inadequate bone formation are also cause for the osteoporosis. So this is the bone modeling, remodeling, where we have osteoclasts, osteoblasts, and osteocytes. Osteoblasts are called as bone forming cells. So they form the bone and it is maintained as osteocytes, that is lining cells. But after some days, these osteoclasts start eating the bone cells and leading to the bone degeneration. So this, if there is a decreased osteoblastic activity and if there is an increased osteoclastic activity, definitely it leads to increased bone resorption and less bone formation, finally ending up into osteoporosis. These are the comparative lumbar spine of a normal spine as well as osteoporotic spine. You can see there is a microarchitectural fracture here on the vertebra. That is actually the disc, and it is actually, it's already have been damaged. And we see a honeycomb appearance in normal bone is very thick and dense, and here in the osteoporosis it's open very, and it's having honeycomb appearance. This is called as a widow's hump or a dogger's hump because there is a loss of height as we age, and there will be microarchitectural fractures in the spine leading to loss of height. or widow's hump or dogger's hump. Normal and this one, both. Okay, coming to the Samprapti, this is Samanya Samprapti, what we have framed during our PG study. Aharaja, Viharaja, Manasik and Anya. All these 4 Nidanas can be broadly classified into Vatavardhaka Nidanas like either Dhatukshaya or Margavarana. Vayor Dhatukshayat Margasya Avaranena Va. So if it is a Sakshat Dhatukshaya Karaka Nidanas, then there will be Poshaka Asti Dhatukshaya. We know that there are 2 of Dhatus, one is Poshaka and one is Poshya. That is Sthai and Asthai. So if there is a Poshaka Asti Dhatukshaya because of Sakshat Dhatukshaya Karaka Nidanas, then there will be Astiva Shruto Riktata. And Chakrapani beautifully tells in the commentary, Riktani iti tuchchani snehadi guna vivarjitani ityartaha. That means Rikta is not empty, it is a snehadi guna vivarjitaha. That means there will be no snehamsha in the dhatus, and hence it becomes a cause for the Vata to enter and make sthana samshaya in the Asti. And if more Vata makes sthana samshaya in the Asti, there will be increased Randrata or Sushirata in the Asti, leading to osteoporosis. And that leads to Vata Prakopa and Astikshaya. Coming to the Margavarana, this is a new concept, that's why I'm giving you more time for this one. In Margavarana, what happens? There will be Sangha in the Astiva Shrotas. If the Sangha is there in the Astiva Shrotas, of course, again there will be Riktata, that means Tehani Guda Vivardita and Vata Prakopa, then finally leading to Astikshaya. This is a specific and copyrighted Samprapti framed by me and my Guru Sankal sir in 2006 for my PG work, not given in any of the books, but we tried to compile the role of Agni in Astikshaya. Because we know Dhatwagnis, Bhutagnis and Jatragnis play an important role in digestion and metabolism. So osteoporosis is being a metabolic disorder where there is a lack of metabolism of the bone or improper metabolism of the bone. We thought an idea that why shouldn't we try a role of hypothetical presentation of Agni Dushti in Astikshaya. So Agnis are 3, Jatragni, Bhutagni and Dhatvagni. Let us discuss about Jatragni first. If Jatragni is Manda, then there will be Amarasa Utpatti, Margavarana, Vata Prakopa and Astikshaya. This is very simple. Coming to Bhutagni, much of the PG scholars and PhD scholars and even teachers don't speak of Bhutagni. But Bhutagni, especially here in Asti, is Prithvi, Teja and Vayu. I'll tell you why. The function of Bhutagnis is to convert the Vijatiya Tattva into Sajatiya Tattva. For example, if we take Ajamamsa directly will not go and sit into biceps or triceps or anywhere as a Mamsa. It is a Vijatiya to the body. That Vijatiya Ajamamsa should be converted into Sajatiya Mamsa so that the body will specifically recognize, and then the Khaleka Putta, Kedari Kulya or Chiradadi or Ekakala Dhatu Poshana acts on the Poshaka Dhatu and then converts into Posha Dhatu. That is why if Bhutagni Manda is there, especially Parthivagni, Tejasandi and Vayagni, improper conversion of Vijatiya Panchamahabhautika Dravyas into Sajatiya Panchamahabhautika Dravyas, that means the whatever food we have taken, it may be a calcium, it may be vitamin D3 or phosphorus, anything that is related to bone will not be converted into Sajatiya Panchamahabhautika Tattvas to the body. Hence, body doesn't understand or doesn't recognize the concepts of Sajatiya Tattvas, and hence there will be lack of Poshana to Dasti Dhatu, leading to Astikshaya. Coming to Dhatvagni, we are so proud to be in Ayurveda that Asthagni, there are 2 things, that is Swasthanastisto Kayagni Ramshaha Dhatu Samstitaha Tesham Sadati Diptibhyam Dhatu Vriddhik Shayodbhavaha. This is told in Ashtanga. That means the Amshas of Jatragni are present in the Dhatus. The Sada and Atidipti, that is weakness and excessive functioning of Dhatvagnis, will lead to either Dhatu Vriddhi or Dhatu Kshaya. How to understand these 2 things? Increased Dhatvagni Apachaya like Basmaka or Atyagni. What happens? There will be more bone resorption that will lead to Astikshaya. If Dhatvagni is increased Upachaya or decreased Upachaya is there, that means formation is less. Metabolism is anabolism and catabolism. Same thing word used in Ayurveda is Apachaya and Upachaya. If Dhatvagni Apachaya is there, bone resorption is more. And if Dhatvagni Upachaya is there, bone formation is less, decreased Upachaya, then obviously formation is less, resorption is more, then leading to osteoporosis. I hope it's very clear, and any questions are welcome at the end regarding the Dhatu Agni role. So Lakshanas we all know: Asti Beda, Asti Toda, Ruja, Asti Shula, Keshapata, Nakapata, Dantapata. All these are there. Dorbalya is there. So we will not waste much time in that. And symptomatology. Coming to the diagnosis, the gold standard, the reason why I have put this into gold color, that is DEXA. This is the gold standard in diagnosis of osteoporosis. The long form of DEXA is dual energy X-ray absorptiometry. It takes the T-score of the bone density, especially in the lumbar spine and the anatomical neck of the femur. These are considered as the standard areas where the bone density should be done by the DEXA machine, dual energy X-ray absorptiometry. Before X-ray, before DEXA, there was one X-ray, that is, we are Indian doctors, Singh's index. They used to see the architectural linings of the bone by X-ray, and they used to guess whether this patient is having bone density normal or less. And advanced stages, we can go for quantitative computed tomography, that is called as QCT. Ultrasound is one way, which is almost 70 to 80% very close to DEXA. And finally, you can go for MRI also, where magnetic resonant imaging can also see the bone density sometimes, but standard is always DEXA. And how to diagnose osteoporosis by T-score of DEXA is normal bone density is anything above -1 is normal. If the T-score is between -1 to -2.5, that is called as osteopenia. And if the T-score of the bone density is equal to or less than -2.5, that is -2.6, -3, -4, anything can be called as osteoporosis. That is the point to be worried, and it should be treated. Coming to the Ayurvedic management, because modern management will not talk, topic is Ayurvedic management. Sadhya Sadhyata, Asti is the fifth among the dhatus, hence it is Kashta Sadhya. It is not Sukha Sadhya, it is Kashta Sadhya. And age factor is also there. And Chikitsa can be divided into 5 parts for this. It is Nidana Parivarjana, obviously. Shodhana can be done, Shamana can be done, Rasayana, and Patyapatya. Nidana Parivarjana, of course, avoid Vata Vardaka Ahara Vihara, because Asti will decrease if Vata increases. Take proper nutritious diet, which is rich in calcium. That is a modern concept, but Dugdha Sevana, Dadi Sevana, or Takra Sevana, based on the Prakriti and Vikriti, we can decide who can take Dadi and who can take Takra, or who can take milk. And exercise regularly, avoid Agni Mandekara Ahara, avoid stress, anxiety, and tension. Intake of cola or carbonated drinks. It's very dangerous, because I'll tell you why. And avoid bad habits like tobacco and alcohol. That is the Nidana Parivarjana that you can do to save the bone density. Shodhana, luckily all the 3 acharyas, that is Charaka first, Vruddha Vagbhata and Vagbhata, Ashtanga Hridaya and Ashtanga Sangraha, all 3 have concentrated on Tikta Kshirabasti. Astyashrayanam Vyadinam Panchakarmani Beshajam, Bastayah Kshira Sarpishi Tikta Kopetani Cha. So this was for Astyashrita Vyadi. But for Astikshaya, directly Ashtanga Sangraha first have told Astikshayajan Bastibihi Tiktako Kshira Sarpibihi. So everyone has come to the same conclusion, that is Basti is Shrestha, because Basti is Shrestha for Vata, and for Asti also Basti is Shrestha, especially Tikta Dravya Sadhita Kshira Grita Basti. Okay, so after Shodhana, for Abhyanga in this Shodhana, we can take any tailas which are having Asti Vardhaka in action, like Kshira Bala Taila, because it contains Kshira and Bala. It is Asti Poshaka, even when it is applied externally, because children are done some massage in the childhood for Asti Poshan and all, but Chandana Bala Lakshadi Taila. Laksha is one of the drug which is very excellent for Asti. It is Sandhaniya, Lakshadi Taila, Bala Taila, Pottam Chukadi Taila, especially when there is Amavastha, you can use Pottam Chukadi Taila. And when there are inflammatory pains and all, you can use Dhanvantram Taila, or as such, any other Vatanashika Tailas can be used. But if these are used, the result is comparatively better. So this was the formula what I regularly use for osteoporosis, as well as Astikshaya, Asti Saushirya, even Astigata Vata. And I tried this formula for even avascular necrosis of the femoral head. And we got excellent results in AVN of the femoral head. Without surgery, the patients are getting better. Even MRI changes are there in AVN by using this formula. I have used Makshika just 40 ml, not 80 ml, not 1 prasrita, Ardha prasrita. The reason is Makshika is Karshan and Lekhana. That is why in Vata, as per Charaka's Basti Adhyaya, we should always use Makshika less in Vata and more in Kapha because of its Lekhana and Ruksha property. Lavana, it is 5 grams we are using. Grita, it may be either Murchita or Panchatikta Gugulu Grita or any other Tiktaka Gritas can be used. That is 1 Prasrita. Kalka, whenever there is Anukta, we have to use the Putevanadi Kalka, or else specifically you can use some Ashwagandha, Shatavari in postmenopausal, or Bala, or Laksha, or even Arjuna. Any other Sudhavarga Dravyas, all that Kalkas can be used. Asti Shrinkala, obviously the doctor is at his liberty to use his Yukti, whatever Kalka you can use, that can be used. Then in Kwatha, we used Panchatiktaka Kwatha, 240 ml, and Kshira, 120 ml. This was approximately the Madhyamatra given by the in Ayurveda, and it is given for Kalabasti. Why Kalabasti? Because Asti is the 5th and it is the middle dhatu. That is why Yoga Basti may not be sufficient. But even in Yoga Basti, it is told that 8 Bastis, every day 1 Basti reaches 1 dhatu. Anyways, we will not end up into the discussion. But the deeper the dhatus, we go for Karma Basti, medium it is Kala Basti, and in the superficial dhatus, we go for Yoga Basti. That is one of the concepts that we have learned from our gurus. In Shamana, there is something called as Samanya Siddhanta. That means Swa Yoni Dravyas. Dravya Samanya, Guna Samanya, Karma Samanya. So in Dravya Samanya, obviously we cannot eat bone for bone. It is very hard tissue. That is why all Charaka Shushruta everybody says that Asti Tarunastnam. Cartilages can be given to eat to the patient. But many patients are not non-vegetarians. And hence in my UG, that in my PG, I used Ajasti Basma. The bone of Aja was taken and the Basma was prepared, and by giving the Putta, and we used this Ajasti Basma capsule for Astikshaya, and we got excellent results. Similarly, we can use Sudhavarga Dravyas like Shanka Shukti Kapardika. Naturally, they are Sudhavarga Dravyas, and they are the richest source of calcium carbonate, and they can be a natural source for calcium. We can use Godanti, of course, Kukutandatak Basma, and Kachapa Prasthasti Basma. During my PG, from the renowned practitioner of Gujarat, Vaidya Tapan Kumarji, I heard in one of the lectures that in some parts of Chennai and Tamil Nadu, the Siddha Vaidyas are also using Manavasti Basmas in some of the Asti Vikaras. I have not seen, but I have heard. This statement needs to be validated. In Gugulu preparations, since time immemorial, that in BHU also, including 1969, Lakshadi Gugulu has been trialed for fracture healing effects. And even modern people are using this Lakshadi Gugulu, hence Lakshadi Gugulu can be a drug of choice for Astikshaya. Abha Gugulu, Abha is nothing but Babul, and Babulu is Asti Sandhani, of course. Aditya Paka Gugulu, as the word itself says, this Gugulu is prepared in the sunlight. It is prepared in the sunlight. The drug is exposed to sunlight, and we presume, or hypothetically we can say that during preparation, the drug absorbs the vitamin D3 from the source of sunlight, and then it is good for bones. And even Panchatirtha Gugulu tablets are also, because in Asti and Majjagata Vyadis, Bhahyabhyantara Tikta Grita Snehapana is stored. These are some patent medicines I don't want to highlight. Rasayana Prayoga. Ekamulika, of course, this was my PhD drug, Ashwagandha and Shatavari. Even Brahma Rasayana, Chavanprash, Shilajata Rasayana, and Nagabala Rasayana can be used for Asti Kshaya. During my PhD, I worked on Ashwagandha to know why it is good for bones. These are all the Tikta Rasa, Kashaya Rasa, Lagu Snigdha, but I'll come to the point of Shatavari also, and in discussion I'll tell why these are good. Shatavari, of course, is a drug of choice in postmenopausal osteoporosis. We all understand Shatavari is a rasayana for the Stree, and it is a highly having estrogenic activity, especially the phytoestrogenic activity. If anybody takes HRT after menopause, there will be lots of side effects. Maybe because of HRT, there may be cervical cancers or breast cancers if taken wrongly or inadequately. But if we use phytoestrogens, I think we can reduce the risk factors of side effects, and it is an excellent bone tonic also. It increases the estrogenic activity as well as the osteoblastic activity. I will discuss in detail about of these two drugs in my discussion. This was the Shukti we collected from the seashore of Jamnagar, and we prepared the Shukti Basma in the pharmacy and we used it. And this is the liquefied Laksha. It needs a very optimum temperature for liquefaction, or else it will be burnt or it will be becoming very hard. To prepare Laksha Gugulu, we used, and Laksha is Sandhaniya, and Urakshata also. Charaka says this is the drug of choice of Sandhaniya. Asti Shrinkala, this was also my drug, Caesar's quadrangularis. And as the anatomically or the physically, this drug looks like bones joined together. It is quadrangularis, triangularis. There are many species of Asti Shrinkala, and works have been done on Asti Shrinkala, and it is one of the content of Laksha Gugulu. This is also best bone healer. This is Arjuna. I will show you the microscopic test of Arjuna. Arjuna is richest source of natural calcium, but it is Vruddhi also, as well as it is Asti Poshaka. Nagabala, controversial drug. Some people will say it is Grevia hirsuta. Some people will say some other thing. So we use this one for our trials, Sida spinosa, and this was a Gugulu. This is the microscopic picture of Arjuna. It contains rosette crystals, that is calcium. So if we give Arjuna Kshirapaka, it has a double effect of Vruddhi as well as maybe Asti Poshaka, because milk is there. Along with Godubda we can give. Coming to the discussion of treatment, why you used Asti Kshaya is high incidence after 40 or 50, because Charaka says in Vimanasthana 8th chapter that Atah para hiyamana dhatpindriya bala virya paurusha parakrama, etc. etc. So Dhatu Kshaya takes place after 60. Naturally, Asti Kshaya takes place. And Sushruta in 14th chapter of Sutrasthana says that the Annarasa in Vruddha, this is very important. Sa eva Annaraso Vruddhanam jara paripakva shariratvat aprinano bhavati. That means as the old age people body is jara paripakva, hence the Annarasa in Vruddha will not do proper prinana. And Dalana commenting it is not a prinana, it is Ishat prinana yavat jiva dharanartham, until only to sustain the life, not to nourish the dhatus. In old age, dhatu nourishment is reduced. So old age, that is decreased calcium absorption, increased bone resorption, leading to Asti Kshaya. So why in females? Because naturally we all know Ayurvedic scholars that Asti is a Pitruja Bhava, hence in males, Astis are more strong compared to females. And one more reason scientifically, by the time of peak bone mass is achieved, bone mass is 1/4 to 1/3 greater in men than in women, naturally. And also study says that the total bone mass is 2965 grams in men compared to 2368 grams in women. However, male skeletons are stronger and BMD is 13% higher in males. That is why the ratio is 1:4. So coming to some people nowadays, especially young girls and young boys also, they are wanting to be in not having Meda Dhatu in the body. They don't want to look plumpy. They want to maintain a figure called as zero figure, or they don't want to have any adipose tissue in the body. That is one of the very bad sign that is going to happen. The zero figure of Bollywood or Hollywood is very dangerous, because the simple question what I asked to them is, if there is no Meda Dhatu in the body, how can there will be a Sara Bhaga to the Asti Dhatu in the body? So we need a Sara Bhaga from the Meda. Meda should be there. And now we all know that cholesterol is good for health, not bad for health, because now all these statins are all banned in America and all. So Meda Dhatu should be adequate. I'm not telling Meda Dhatu should be more. I'm not telling to suffer from Meda Vruddhi or Staulya. There should be optimum Meda Dhatu that is required for the body, so that the Sara Bhaga from the Meda Dhatu will nourish the Asti Dhatu, or else zero Meda, of course, no Sara Bhaga for the Asti, hence there will be Asti Kshaya. And menopause, we know that estrogenic activity is reduced. Coming to Prakriti, I told low bone mass index. And because of that, there will be Asti Kshaya. And Purushadhara Kala, Astidhara Kala, I told in Dalana on Shushta Kalpasthana 4th chapter, the absorption of calcium and other minerals is high in the large intestine. So if somebody is suffering from ulcerative colitis, Grahani, or may it be IBS, malabsorption syndrome, those people are at a high risk of osteoporosis. That means Ayurveda was very great that they said Ya eva asti darakala, sa eva purusha darakala. Now this is interesting. We said Nakha Vikara, Danta Vikara, and Kesha Vikara. Now this is a special machine developed by a scientist called as Mark Towler. He is a research scholar in Limerick, Ireland. If you place your palm in this machine, it will analyze something called as, this machine is called as selective bone quality test. It uses the Raman laser system to measure the disulfide bond content of the fingernails. Disulfide bond content of the fingernails. So if this disulfide bond contents of the fingernails are weak, your nails will become brittle. In my PhD also, I used to collect the fingernails of the patients after they use the nail cutter, and we used to try to break it and see if the fingernails are flexible and elastic, the bone density is strong. And if the nails which are cut from the nail cutter breaks by just 2 folds or 1 fold, it is very brittle like a stick, then it is definitely the patient will have osteoporosis. Anybody who is interested can do this on the patients. Interestingly, patients have noted that if the fingernails become much harder after they start on various osteoporosis therapies, that means the Asti Poshaka Dravyas are also Naka Poshaka, because it is the mala of Asti. This is the one of the references I have given, which is published by Journal of Women Health in 2005. And one more research published in Journal of Clinical Endocrinology and Metabolism in 1994 says that people with gray hair by age of 40 are more like 4.4 times more likely to suffer from osteoporosis. This will not hold good now because of lifestyle and pollution, as well as use of excessive chlorinated water, as well as more of iodized salt. Even children of 6 years, 4 years are also suffering from gray hair. That is, the concept is different, but not other reasons. If only there is a gray hair by the early age of 40, then definitely if there is a brittleness of the hair, hair fall, which is brittleness, then also there will be definitely osteoporosis. Coming to the third paragraph, doctors don't have the foggiest idea why gray hair increases your risk of osteoporosis, but they do know that the condition of your teeth and jaw mimic what is happening to your bones. That means Danta. I have taken Nakha, Kesha, Danta. All three scientifically proved in 1994 and also 2000 something. And it has been already told by all the acharyas thousands of years ago that Astikshaya, Kesha, Roma, Nakha, Danta, Patana or Nakha Vikriti have been told. So even nowadays, the periodontologist, the dentist also agree that there is a definite relation between bone and dental caries. Now coming to Ashwagandha, this is a research article published in 2003, that is Journal of Ethnopharmacology. Female rats were ovarectomized, ovaries were removed, and in that, this Ashwagandha was given, Shatavari was given, and then we saw that Caesus quadrangularis, this is about Caesus quadrangularis I'm talking, Asti Shrinkala, 2003. Asti Shrinkala, definitely the ethanolic extract of Asti Shrinkala showed potent potent anti-osteoporotic activity. That means it is having a good anti-osteoporotic activity. Coming to Lashadivgulu, Withania somnifera extract. This is Nagireddy as published in 2006. This Ashwagandha, by the virtue of its positive effects on the endocrine system, may have increased the bone formation to reduce the bone resorption. Hence, bone minerals are increased, treating osteoporosis. So this is a published article on Ashwagandha. Coming to the conclusions, Asti Sausharya or Astikshaya can be compared to osteopenia or osteoporosis. And Samprapti of Astikshaya is not as simple as we just tell one shloka, that is Astikshaya Kesha Ramana Kadanta Pata. It is a complex mechanism because we have to think about Vata Vriddhi, Meda Dushti, Asti Dushti, Majja Dushti, Purusha Dushti, as well as all the three Agni Vikaras. It is a complex mechanism. The involvement of Psi cannot be delayed, and the Dhatwagnis are very important. The incidence of Astikshaya is more in females, especially after menopause. And in Asia, especially by 2050, there will be highest risk, fracture risk in the world. Ayurveda always says the use of Rasayana is very best in Dhatukshaya Vikaras as well as in Jara and Vardhakya. Hence, in Ashwagandha, Shatavari, Lashadi Gulu, Sudhavraga Dravyas, etc. can be used as the Samana Dhatu Vardhaka Dravyas, either by Samana Siddhanta for Naimitika Rasayana. Only calcium supplement is not the treatment of choice, because I have seen many people who are taking non-veg food or calcium diet, but if you are not exposed to vitamin D3, that is early morning sun, that is a Ushapana, it is before 9:30 or even after evening 4:30, the red sun what we see, because even though now also they are giving vitamin D3 orally, but everyone agrees that the best source of vitamin D3 is sunlight, and the skin is the best organ that generates D3, and oral D3s are not that much of important in osteoporosis. Tips for better bones, because of today it's World Osteoporosis Day. Take diet rich in calcium and vitamin D, and also exposed to vitamin D3 sunlight. Exercise regularly and optimally. Too much is too bad. Avoid regular use of beverages like coffee, soda, alcohol, or cola, something like that. Because about cola, we have seen one video that even the teeth can be dissolved in a bottle of cola if you keep it for more than 6 months. So the enamel is the strongest tissue in the body of the teeth, but what about the bone, and also what happens to the soft tissues of the body? Hence, all these carbonated drinks are very dangerous for the osteoporosis, and bad habits like tobacco and smoking, everything should be avoided. Care should be taken to avoid risk of falls in old age. So balancing and proper care should be taken for balance. Yoga and all will be definitely helpful for these people. Use regular calcium-rich green leaf vegetables. Be active and lead stress-free and anxiety-free life. I have just quoted this. Just 2 glasses of milk a day keeps osteoporosis away, as it is said. And don't hang your bones. The carry-home message is rather treasure your bones. And finally, I'm fighting against osteoporosis. Help your skeleton to fight against osteoporosis. Centuries old Ayurveda has centuries ahead. I have put this word because of Kesha Roma Nakadantapata is very scientific nowadays. Tiktakshira Basti is very scientific nowadays. Last 2 minutes about the action of Tiktakshira Bastis. Arunadatta and Hemadri commenting on Tiktakshira Basti says that the Snigdha property of Grita and the Shoshana property of Tikta, when they combine together, produce a Kharaguna, which is the Asti Guna. Because many question that Tikta is Vata Vardhaka, why you are giving Tikta in Vata Vardhika Astikshaya? Even though Tikta is Vata Vardhaka, Tikta has Shoshana property, and Grita and Kshira are having this Snigdha property. So Arunadatta and Hemadri commenting on Ashtanga says that the mixture of Snigdha and Shoshana is equal to Khara, which is nothing but the quality of Asti. So our science is very scientific, more scientific than any other science in the world. That is why I have put this statement, centuries old Ayurveda is centuries ahead. Thank you very much for patient listening. And I wholeheartedly thank Pawan Kumarji and all the organizers of this marathon innings of repeated conferences of webinars for giving me the opportunity to share my views on Ayurvedic management of Astikshaya or osteoporosis. If any questions are welcome. Over to you, Pawan sir.
Thank you. Thank you very much, Dr. Sanjay. Thank you very much. Very nicely explained, and flow, excellent flow of knowledge. Ocean of knowledge, no doubt, ocean of knowledge. Agnihotri sir.
Namaskar, Mohanji. Thank you, Dr. Sanjay ji. Really, you have presented your whole presentation masterly. The fact is that you're not speaking, your knowledge was speaking in your words, by your mouth. A few things which appealed a lot, that you put forward the whole description from modern side as well as the Ayurvedic side. And important is this, that wonderfully you, of course, quoted the references of our text, that whatever said to be Purish Dharakala is similar to the Asti Dharakala. This is a very appealing point, and every Ayurvedic student must underline to this issue, so that it will be very easy to handle such osteoporosis cases in that way. And again, because this is a striking point. Ya eva Purish Dharakala, sa eva Asti Dharakala. I noted down that point. And again, you underline a very important thing, that how to manage, apart from the Nidan Paksha, and then the emphasis should also be given on the side of the Ahar. First Ahar, then exercise. It itself is suffice most of the age span of the males and females both. And lastly, when you referred and advised that 2 glasses of milk a day keeps osteoporosis away. It is just appealing. So a few things are just mentioned by you in a slogan form, and that's why the comments in chat box are very encouraging in your favor, that you presented very well, very nice, and of course very understandable. So when you were speaking, I just referred to this webinar's link to Professor Chandolaji. He is there in Dehradun, so that he should also appreciate you. I don't know whether he has joined or not, but I came to know it's a matter of pleasure, because Professor Chandola is a very good friend of mine, and we had been there in BHU. So I appreciate and I congratulate you. And please keep on. I do hope that your students might be having a lot of good information, updated knowledge. Thank you so much.
Thank you, sir. Thank you very much, sir. It's all the blessings of Chandolaji, Bagel sir, and all senior CP Shukla sir, that they have given me this knowledge.
It is the genes of Jamnagar itself. Why can't you say like this? Because
Yes,
our gold medalist Professor Pawan Kumar Sharma is always with you, and
Yes,
he
sir,
selected out you on this issue because you've got the PhD work on it. So it's a combination of good say grahas. नवग्रह
Yes, sir.
इतने अच्छे इकट्ठे हुए हैं कि आज सबको
sir.
लाभ मिल रहा है.
Yes,
सर्वे
sir, yes.
गया शांत करा बोल.
जामनगर तो काशी है सर आयुर्वेद का.
काशी है, देखिए नहीं.
Yes, sir.
काशी
Yes, sir.
काशी है, सिमली जरूरी. जामनगर काशी जैसा है.
Yes, sir.
ऐसे कहिए ना भाई. काशी को कहाँ छीन लिया, फिर हम कहाँ जाएंगे? हम तो काशी, हम तो BHU वाले हैं ना, फिर तो.
Yes, sir, yes, sir, yes, sir.
काशी काशी है, जामनगर भी काशी है.
Yes, sir, yes, sir.
Thank you so much.
Correct. Thank you, sir.
Thank you, Dr. Sanjay. Now I would like to request Dr. Karthika S, Assistant Professor, Ayurvedic College, Coimbatore. Welcome, Dr. Karthika. Welcome.
Thank you, sir. Thank you, sir. Thank you. So, sir, am I audible?
Loud and clear.
Hello, sir. Am I audible?
Yes, yes. You are audible.
Sir, my screen is visible.
Yes. No screen. You are visible.
Okay, sir. Just a minute, sir. I will just. Hello, sir. Hello. Sir, am I audible?
Yeah, you are audible, but the screen is not. The slides are not there till now.
Hello.
Yeah.
Yes, sir. Is it visible now?
No, madam.
Just a minute, sir. Sir, visible now?
No, not yet. If there is any difficulty, you can send your this PPT presentation to Professor Pawan Sharma's WhatsApp. They will manage for you.
Yes, sir.
And meanwhile, you can continue your presentation with your introduction and your elementary subject. By that time, the slides will be open.
Just a minute.
You please start your visual presentation, and meanwhile technical things will be addressed by then.
Just a minute, sir. I will send this to Pavan Kumar, sir. Then
Yeah.
ഇത് ഇതിനകത്തല്ലേ?
Today's participant strength is very good. It is 44. Starting it was say 23 itself. So everybody is interested to hear
Sir,
from
it was 46, sir. Highest 46.
IS 46. I was
46,
watching
sir.
either and there. It is 46. It's our pleasure.
46.
Yeah.
When you were speaking, it was 46, sir.
Good. Because it is started at from 23. So persons are joining. This is all the academic interest to the students also. Dr. Karthika, you please
Oh, yes.
start by
Yes,
your
sir.
own.
Yes,
You
sir.
have got,
I'm just
all
sending.
ability to speak with.
Yes, sir. Yes, sir. Just a minute. I'm sending my presentation.
You may ask to any of your colleague if they are with you to manage the technical side. And
Yes,
you
sir. Now I
start.
have.
Okay.
Yes, sir. Now I have sent to him. May I start the presentation, sir?
Okay. He will do. He will do within minutes. You are having that academic stuff with you. Let us now start. Yes, got it.
So, a very good afternoon, everyone. And at the beginning, I would say sorry for the delay. I would like to thank you, the organizers, for giving me the opportunity on the World Osteoporosis Day to share some of my views on the osteoporosis, the Ayurvedic cure. Actually, Dr. Sanjay sir has done a wonderful presentation, and of course, he is the authoritative person to tell that. So I will start my humble presentation with all your blessings. So, osteoporosis is defined as a progressive systemic skeletal disease characterized by low bone mass and microarchitectural deterioration of bone tissue with a consequent increase in bone fragility and susceptibility to fracture. So, as sir have already mentioned, it is one of the major problem affecting the worldwide population than when we consider the incidence of heart attacks or any other diseases. So it has reached such an epidemic proportions in the 21st century, and over 200 million people worldwide suffer from this disease. Osteoporosis is the most prevalent in urban populations, and also women are more suffering than men. So one of the etiological factors of these things are the modern life, especially the sedentary habits, faulty diet, especially the junk and fatty foods. And due to this, there will be a deficiency in vitamin D3, calcium, and other minerals, alcohol consumption, emotional distress, and hereditary factors. Also, the overactivity and the female gender is also a causative factor because of the physiological and hormonal specializations in the body. The increasing age, the menopausal syndrome, the weight gain, thin body build, or the excessive weight is both are the factors responsible for the osteoporosis. And in some cases, the nutrition and pregnancy, overnutrition and undernutrition also, and some pregnancy related problems also leads to osteoporosis. So the osteoporosis is again divided into the primary as well as the secondary causative factors. So the primary causative factors include the postmenopausal type 1, and it occurs within 15 to 20 years after the onset of menopause. Age-related type 2, a long history of calcium deficiency is largely responsible for this condition and which is called senile. And osteoporosis, because as it occurs in patients over the age of 70, the senile one is also the primary causative factor of the osteoporosis. Coming to the secondary factors of osteoporosis, especially the endocrine disorders, thyrotoxicosis, pituitary insufficiency, and the drug intake, that is long-time intakes of corticosteroids, long-term heparin use, anticonvulsant drugs, and maybe one of the important reasons in this modern era of causing the osteoporosis. And the inherited factors, especially the conditions like osteogenesis imperfecta, the nutritional deficiency due to anorexia nervosa, alcoholism, the mental factors, malabsorption syndrome due to many causative factors, and also immobility, like general lack of weight-bearing exercises, local like hemiplegia or fractures. These are all responsible for the induction of osteoporosis or the causative factors of osteoporosis. And other rare factors like the chronic hepatic disease, pregnancy also deny the persons in absorbing the calcium or the minerals, which is essential for the formation of bones. And especially in these days, the drugs and uncontrolled use of drugs are also one of the major factors resulting in a drug-induced osteoporosis. Especially drugs associated with the increased risk of osteoporosis are glucocorticoids, cyclosporin, cytotoxic drugs, anticonvulsants, excessive alcohol, excessive thyroxine usage, heparin, lithium, and also proton pump inhibitors, which is now commonly used with every drugs. Coming to the signs and symptoms of osteoporosis, low energy fracture, that is the fracture with the very less force, is one of the major symptom of osteoporosis. Stooping or height loss of a person, bone pain, joint pain, low back pain, and fractures, especially in the vertebral and the hip area, are the most common signs and symptoms of osteoporosis. As you can see, the normal bone and the reduced bone mass, and when it comes to osteopenia and when it comes to osteoporosis, the especially honeycomb appearance in the bone is visible. And osteoporosis is always considered to be a silent thief, as the osteoporotic things always come in a silent way, and when it is manifested as a fracture or as a bone dislocation only, then it is coming to visibility. So it is often called as a silent thief. Coming to the, I will come to the quick pathogenesis of osteoporosis. It is having a complex pathogenesis. It is ultimately the consequence of genetic, hormonal, dietary, lifestyle, and physical factors. Because of these etiological factors, imbalancing of bone remodeling, I think Dr. Sanjay sir has said that beautifully with the pictures, and thus this results in the reduction of the peak bone mass. And some of the cases there will be the mutation of genes, especially lipoprotein receptor related protein 5, which is a major role in developing osteoblast and chondrocytes, collagen I-alpha-I, major conforming element in bones. As we know, collagen is one of the important factors in helping in the formation of bones. And a gene called bone morphogenic proteins, BMP, philostine, which determines the BMD, that is bone density. The diagnosis of osteoporosis is done by different methods in bone densitometry. For bone mineral assessment, we have SPA, single photon absorptiometry, DPA, dual photon absorptiometry, DXA, which has been set as a golden standard, as we have seen in the previous session, dual X-ray absorptiometry, QCT, quantitative computerized tomography, QUS, quantitative ultrasound, and that are the major things for the diagnosis of bone density. And bone density is a major determination of bone strength and fracture risk. And BMD is measured by a dual energy X-ray absorptiometry, DEXA, that is considered as the gold standard. And this can result in a value expressed in gram per centimeter cube. And when converted into T-score, and it is compared to value of a healthy 30-year-old, especially in the hip joint. And WHO has given this definition of the osteoporosis by BMT. When the T-score is from 0 to 1, it is considered to be a normal, and is from -1 to -2.4, it is considered to be a stage of osteopenia, and from -2.5 or greater, osteoporosis, and -2.5 or greater and a low impact fracture, it is become a severe osteoporotic stage. And this we can see clearly the stages of osteoporosis from a normal bone to osteopenia to beginning stages of the osteo. Sir, next slide, please, sir. Sir, next slide, please, sir. So these are the stages of osteoporosis from a normal bone to osteopenic bone to the beginning stages of osteoporosis, and then we can see the classical honeycomb appearance in the severe osteoporotic stage. And the major investigation, blood investigations, as we all know, include CBC, ESR, serum calcium. The normal values are there, serum phosphorus, serum alkaline phosphate, liver function test, renal function test, and of course the thyroid hormones T3, T4, TSH, and the parathyroid hormones, and the level of vitamin D, which is very essential in the bone health, and also protein electrophoresis. The management of osteoporosis is, I will have a very brief description. Dietary or lifestyle modification, generally use biophosphonates, oral drugs like calcium and vitamin D supplements, and the drugs to improve bone density and reducing the bone turnover. These are one of the major important things in the management of osteoporosis. When this was a brief description in the modern physiology about the osteoporosis and the occurrence. So when coming into the next, the Ayurvedic view, osteoporosis is, in Ayurveda, it is clearly described the osteoporosis under Dhatu Vikriti Lakshanas, especially under Meda, Mamsa, Asti, and Majja Dhadus. We can see all the osteoporotic Lakshanas or the symptoms which is described under the Dhatu Vikriti Lakshanas, especially in the Sutrasthana of Ashtanga Sangraha and Ashtanga Hridaya. Coming to the Nidana factors, always the Vada Dosha Dushti is one of the major cause of osteoporosis or Astikshaya. As we know, it has the Asraya Sambandha. And Ashtanga Sangraha Sutrasthana, as mentioned, Tatra Astini Sthido Vayu. And again, the Vada Dushti can be occurred due to Vegadharana, Adivyayama, Ruksha Kadu Tikta Kashaya Shida Dravya Adiyoga, Ratri Jagarana, Adhyashana or Ahida Bhojana, Rekta Moksha or Panchakarma Adiyoga, Ritu Dosha Prakopa, which causes the Dushti of Dosha Dhatu and Mala, then Ubhavasa. All the Vada Prakopa Nidanas can lead to Astikshaya or the Vada Dushti. Also, the Manasika Dosha Prakopa due to Bhaya, Shoga, Krodha, Chinta, and can also lead to the Vada Dosha Dushti and hence the Astikshaya. Also, when it comes to the Nidana, Srodha Rodha and Srodha Dushti is one of the major factors in causing the Astikshaya. As we all know, Purva Dhatu Param Kuryat Vriddha Kshenishcha Tadvida. That means the Purva Dhatu Rasa or Vriddhi leads to the Poshana or Shaya of the Uttara Dhatu, according to, as we all know, the Kaleka Bodhanaya, Kedara Kulyanaya, the Rasa Vriddhi, Rasa Dhatu, Tarabhaga, Rekta Dhatu Poshana, then Mamsa Dhatu, and thus Medo, Asti, Majja, and Shukra. So the Purva Dhatu Shaya will leads to the Shina of the Uttara Dhatu. Also, as we all know, the Rasa Dhatu Shaya is in the beginning stage. We can consider this as a stage of a beginning of osteopenia, or the then when it comes to the Mamsa, Medo, and Asti Dhatu, we can see the symptoms as we will explain later. We can see as it comes from the osteopenia to osteoporotic and severe osteoporotic changes. So another causative factor is the Agni Vaishamya, Jatarakni, and Dhatu Agni. And Dr. Sanjay sir has already told, like, we should also consider the Hudakni also in the previous session. And the Ashtanga Sangraha Kara has clearly told, ye pachagamsha dadunam tesha manta aditaishneda vriddikshescha dadunam jayade. That means the Agni Vaishemya, Agni Vriddhi or Shaya of the Dhatus or the Dhatu Agni will lead to the Vriddhi and Shaya of the Poshya Dhatu or the next Dhatu. So the Agni Vaishemya, the Jadaragni and Dhatu Agni, and of course the Budagni also plays a major role in the Astik Shaya or Asti Poshana. Once the Dhatu once the Dhatu Vikriti is there, again the Asti Dhatu will ultimately occur. Coming to the Samprapti of Astik Shaya or osteoporosis, Dosha Dushta receive Dhatun Dushyendi Upayamana. As according to Ashtanga Sangrahara Sutrasthana, Dosha Dushta Dosha will again cause the Dushana of the Rasa Dhatu and all the malas. And Dhadunam ye Pajagamsha Tesha Manda. Again, we have discussed in the previous slides. Dhadunam ye Pajagamsha Tesha Manda Adi Taishneda Pratikshaya Dhaduna Jayade. And Purva Dhadu Param Kuryat Vriddha Shinascha Tadvida. That means the Purva Dhadu is Vriddha or Shina will result in the Poshana or Shaya of the Uttara Dhadu. Again, or by all these factors, the Vada Koba by Dhadu Shaya and Marga Varoda, and again, like vice versa, will cause the Astik Shaya. Osteoporosis. When we consider the Dhaduk Shaya Lakshanas in the Ashtanga Sangraha Sutrasthana, we can see clearly the osteoporotic or the Astis Dhadu, how the Astis Dhadu is affecting from the Rasak Shaya Lakshanas. It is clearly mentioned. As we can see in the Rasak Shaya, there will be Spandana, Khatana, Alpadayam, Abhicheshtada can be seen. That means Spandana or Khatana, there will be the Khatana of the Sandhis that is explained, and also that may be a beginning of the osteoporotic changes or the Dhaduk Shaya Lakshana. There is a starting of the osteoporotic changes in a body. And when it comes to the Mamsak Shaya Lakshanas, we can see the Sandhi Spodana and Dhamani Shaidalya. Again, the osteoporotic changes we can see, or Astik Shaya Lakshanas, or the symptoms affecting the Asti we can see here. And when it comes to the Medak Shaya, there will be Kadiswaba and Sandhi Shunyada again. And when it comes to the Astik Shaya, the clear symptoms like Danda, Naka, Roma, Kesha Shadana, Sandhi Shunyada, Sandhi Shaidilya, Asti Toda, Asti Baddha, and Asti Baddha Mamsabilasha is also seen in a person. So we can see here clearly there will be we can, as Sir has mentioned in the selective bone quality test, how the determination of the strength of the nails and hair, how it can determine the strength of the bones. Clearly in our classics, it is said, as in Astik Shaya, there will be Danda, Naka, Roma, Kesha Shadana, Sandhi Shunyada, Sandhi Shaidilya, then Asti Toda, and there will be a typical symptom like a Asti Baddha Mamsabilasha that is experienced by the person. And also when it comes to the Majja Shosha, the severe osteoporotic changes we can see like the Asti Saushirya and also Toda and Daurbalya. As we can see from these Lakshanas, we can see a stage of osteopenia, that is a reduction in the bone mass, that to the osteoporosis, that is bone pain, Asti Toda, continuous bone pain, which can be related to Asti Peda, fractures, Angabanga, Srama, Sandhishula, Dandabanga, Kesha Padana, bending of forward bending of spine like Vinamana, that is again the loss of height of a person, weakness, Balakshaya, brittle and soft bones, that is Asti Saushirya, difficulty in walking, Sandhi Shaidilya. And when coming to the Chigilsa, this is next slide please, sir. When we come to the Chigilsa, there is not much mentioning of the Astik Shaya Chigilsa in the Chigilsa Sthana. Instead, in the Dosha Vediya Madhyayam itself, the Chigilsa or the Chigilsa Sutra of the Astik Shaya has been mentioned very clearly. In Ashtanga Sangraha Sutra Sthana, it is told that vritti samane sarvesham viparite viparya. As the bone and the asti dhatu and the vata dosha are having the asraya sambandha, and also the vritti of the dhadus will cause the vritti of the dosha, or will cause the vritti of the dhadus. But it is opposite in case of the vata dosha and asti dhatu. As we all know, tatra astini sthido vayu asrik svedediyo pittam shesheshu sleshma tasmat ega vriddikshaya karanam tesha. There is only one reason for the vriddhi and shaya, or the common factors are responsible for the vriddhi and shaya of this asraya bhava, except the vada and the asti dhatu. And it is told as the chikilsa tasmat lengana brahmanabhyam vriddikshaya vikaran upacharet pavane tu brahmana lenganabhya. So the vada dosha must be treated in the opposite way. That is, always the vata dosha should be treated as the brahmana. Brahmana chikilsa or poshana must be done. And also in the Ashtanga Hridaya Sutra Sangraha and Hridayakara has already told Sarvatra cha dravya guna karma viparya tulya bhavena aviruddhena. That means the dravya, guna, karma must be the similar to the dhadu or the dosha, will cause the pushti, and it must be of aviruddha. Also, Ashtanga Hridaya Sutra Sthana, again in Charaka Samhita, also Ashtanga Sangraha also has given the almost the same reference of Astikshaya. Asti Samshaya Jadan Shira Grade Tikta Samyuda Vastavi Tada. That means the Shira Vasti is given importance with the Tikta Dravyas, is specially mentioned in the Ashtanga Sangraha and the Sutra Sthana when it is mentioning the Asti Samshaya Chigilsa. When it comes to the Samanya Chikilsa in common practice, we always do a balance of Vada, because we all know when disturbed Vada flow through the body, nutrients don't get delivered to the bones. Also, the balance of Kapha is also required, as impaired Kapha metabolism disturb the bone rebuilding process, because it is the Sleshma which is giving the stability to the Sandhis and the bones. So bone rebuilding process is necessary for the as the kapha need to be maintained, and it can even create osteoporosis even when the nutrients are available. When the kapha is not balanced, even the nutrients are available to the body also, it can also lead to a astikshaya. So the balancing of kapha is very important. And the balancing of dhadus also is very important to restore the equilibrium, as we told, the poshya and the poshaka dhadus. And it is very important to restore their equilibrium, particularly that of asti dhadus, which forms the bone mass. Next slide, please, sir. When it comes to the chikilsa, the snehana we can apply. The snehana, svedana, and the panchakarma chikilsas we can generally apply to the treatment in case of the osteoporosis. Internally, we can give different snehapanas like Indukanda Kritam, Gugulu Tikta Kritam, Mahatikta Kritam, Mahasneham, Yamaga Snehapanam, Rasatailam, etc. in case of snehapana as such. And while considering the snehapana, the Agmapajana in the person must be done with the Divanapajana drugs. And externally, the Abhyanga is also mentioned. Especially we can do with the Mahanarayana Taila, Kotanchukadi Taila, Dhanvantaram Taila, etc. and all the Vadahara Tailas. And in the Svedana, we can use the Patra Podali Svedam, Shashtiga Shali Pinda Svedam, especially with the Bala Kashaya and Shira, as Shira has very effect internally and externally also. Upanaha with the Mahasneham and Upanaha Granadravyas is also very beneficial in case of these Nehana therapies. Also, when it comes to the Panchakarma or the Shodhana therapies, Matra Vasti is very important. Many Tailas like Dhanvantaram Tailam, Mahanarayana Tailam can be used for the Shodhana therapy, Matra Vasti. Again, in the Kashaya Vasti, Shira Vasti with the Tikta Gradam or Mahatikta Gradam, as mentioned in the Ashtanga Hridaya. Even Nasya can be given with the Shira Bala, one Dhanvantaram, one not word Avarti, Maharaja Prasarani Tailam, and all the Vadahara Nasya, especially it is very helpful in the spine disorders due to osteoporotic changes. And next slide, please, sir. When coming to Shamana yogas, there are different Shamana yogas, which is especially because of its ingredients like Dashamula and different drugs, especially like Arjuna, Tila, Ashwagandha, and Rasna. We can all the Shamana yogas have the ingredients, and it is very helpful in Amapajana and also Asti Dhadu, Asti Majja Dhadu Poshana. Like Indukandam, Mahatikta Gradam, Gugulitikta Gradam, Maharasnadi Kashayam, Rasnadi Kashayam. Gandhatailam is again one of the important drugs we can give in the osteoporotic changes because it is prepared with the ajakshira, tila, and it is very helpful in making the in reducing the osteoporotic changes and giving the strength to asti dhatu or the bones. Rasatailam also is practically seen very good, in, especially in many osteoporotic changes, in giving to the asti majja strength to the asti majja mamsa dhadus. Laksha Gugulu, of course, Laksha is the famous drug. Rayo Dashanga Gugulu. Next slide, please, sir. And coming to the Rasa Yogas, which is rich in calcium, Ravala Pishti, Mukta Shukti Basma, Shanga Basma, Kapartika Basma, Kukudandatak Basma, all these drugs are very useful in the, as the Shamana Yogas. And Rasayana Chikilsa. When we come to the next slide, please, sir. When we come to the Rasayana Chikilsa, it is also very important in treating the osteoporotic changes. As we all know, the genes also play a very important role in the osteoporotic changes in a person. So different mutation of genes is also occurring, and this can result in the osteoporotic changes. So the Rasayana Dravyas can be very beneficial in acting. As we all know, the Rasayanas have a very effective role in the DNA repair. I have mentioned only very few Rasayanas, and in the previous sessions, we have seen a detailed description of the Rasayana, and the importance of Rasayana has been told by Dr. Sanjay sir. Chamana Prasham, Pipali Rasayanam, Lashuna Rasayanam, Shadavari Gulam, especially with the hormonal, the osteoporosis due to hormonal changes in ladies, it is very beneficial. Coming to the single drug remedies, we have many famous drugs we use like Ashwagandha, Vidania somnifera, Astisringala, this is quadrangularis, Dadima, Guduchi, Haridra, Krishna Chiraga, Prasarani, which is famously used in the Prasarani Adikashayam. And practically we are asking the patients to intake of the Shira Kashayas, especially with the single drugs, and it has been given many magnificent results in the osteoporotic changes, and there is a reduction in the symptoms, and also there is a difference in the bone density after the intake of all these drugs. And also next slide, please, sir. When it comes to the single drugs, the other drugs like Nimba, Shadavari, Shigru, Shundi, Tila, Shallaki, all these are playing a very important role in the osteoporosis treatment, and also it can be single drugs and also given as a combination also, and this is also involved in the many of the yogas which is we are giving in the osteoporotic changes or the Astidhatu Shaya Lakshanas. Next slide, please, sir. Coming into the after the Chikilsa, the external and internal, and also the medicines, Patyam is also very important in treating the disease or in reducing the Astikshaya Lakshanas or treating the osteoporotic changes in the body. So we can advise the patient to having the Padahara Chikilsa, mainly Padavyadi Chikilsa, and also the Charyas, which is reducing the Pada and giving the Asti and reducing the Asti Spudana and Astikshaya. So Madhura Amla Lavana Rasahara, Sniktaushna Annapana, Grida, Taila, Shiram, as told in the previous session, 2 glasses of milk is very effective in reducing the osteoporotic changes. Vasa and Majja also, as intake is also very effective in the osteoporotic changes or strengthening the Asti Dhatu. Then Pradhana Varga like Peya, Manda, Krishara, and Mamsarasa is also very important. Coming to the Dhanya, Chali, Shashtiga, Goduma, Tila, Mutta, and Masha can be used in a daily intake. And the Shaga Varga is also very important, like Shikru, Padola, the commonly available ones, Vastuga, Draksha, Lashuna, Kola, Kapita, Narikela, which are also very rich in the nutrients and also calcium, which is very effective in treating the osteoporotic changes. There I comes the end of my session, and thank you. Thank you all for the patient listening.
Thank you very much. Thank you very much, Dr. Karthika. You have explained everything about osteoporosis, right from Ayurvedic to modern. Now I would like to request Pranjal Joshi from Ahmedabad, sorry, Vadodara. Welcome, Dr. Pranjal. Welcome.
Hello, sir.
Welcome, Dr. Pranjal. Swagatam. Dr. Pranjal will highlight physiotherapeutic exercises for osteoporosis. Excellent topic, doctor. Please proceed.
Thank you so much, sir, for giving me this platform. As I am physiotherapist, I will be talking about some exercises regarding osteoporotic changes in patients. As we all know, the basic thing about osteoporosis is that it degenerates our bone. And due to this, the bone becomes porous or weaker, and it increases the risk of fractures, especially in hip, spine, and peripheral joints such as wrist, knee, ankle, etc. It causes bones to become weak and brittle, so brittle that a fall or even mild stresses such as bending over or cuffing can cause fracture. ये जो ऑस्टियोपोरोसिस है, उसके अंदर हमारा जो बोन का डेंसिटी होता है, बोन मास डेंसिटी जिसको बोलते हैं, वो कम हो जाता है. जैसे कि इस फिगर में आप देख सकते हो, नॉर्मल बोन कैसा, हेल्दी बोन कैसा दिख रहा है, पूरा कॉम्पैक्ट है, एकदम जितने भी मॉलिक्यूल्स है वो एकदम नजदीक है. पर जो ऑस्टियोपोरोसिस वाला बोन होगा, वो अंदर से पोला हो जाएगा, मतलब खाली हो जाएगा, जिसकी वजह से उसके अंदर पोर्स ज्यादा हो जाएंगे, जिसकी पोर्स की जो साइज है वो बढ़ जाएगी, जिसकी वजह से बोन डेंसिटी है और बोन मास है वो कम हो जाएगा. और इसी के वजह से जब भी कोई इंसान अगर गिर रहा है या उसको कोई जोर से चोट लग रही है, तो वहां से तुरंत ही उसको फ्रैक्चर होने के चांसेस बढ़ जाएंगे. अब लास्ट टाइम जैसे मैंने प्रेजेंटेशन में बोला था स्पोर्ट्स डे के दिन, कि अगर आपके मसल्स वीक हैं तो आपके बोन्स भी स्ट्रॉन्ग हो सकते हैं, और मसल्स स्ट्रॉन्ग होंगे, मसल स्ट्रेच होंगे प्रॉपर्ली, तो वो लिगामेंट और टेंडन को भी सही से स्ट्रॉन्ग और स्टेबल बना के रखेगा, जिसकी वजह से बोन की इंस्टेबिलिटी जो है वो कम हो जाएगी, जिसकी वजह से ये जो ऑस्टियोपोरोटिक चेंजेस है वो स्लो हो जाएंगी. वैसे ये एक्चुअली इरिवर्सिबल डिसऑर्डर है, जिसके अंदर जो पेशेंट है वो कंप्लीट रिकवर नहीं हो सकता है. पर जो चेंजेस 60 इयर्स की एज में आने चाहिए थे, उसको हम 80 इयर्स या 90 इयर्स की चेंजेस, 90 इयर्स के एज में उसको चेंजेस लाने के लिए कोशिश कर सकते हैं. ऑस्टियोपोरोसिस जैसे कि सब लोग मेरे जो पहले जो भी स्पीकर्स थे उन सब ने बताया है कि वुमेन्स के अंदर सबसे ज्यादा देखा जाता है ड्यू टू देयर हार्मोनल चेंजेस फ्रॉम देयर टीन एज टू मेनोपॉजल एज. पर एक रिसेंट स्टडी जो है वो ये बता रही है कि जो ऑस्टियोपोरोटिक चेंजेस होते हैं वो स्पेशली वाइट पीपल जैसे कि अमेरिकन सिटीजन्स और एशियन वुमेन्स के अंदर ज्यादा देखा जाता है. एशियन अमेरिकन की पहले बात कर लेता हूँ. अमेरिकन के अंदर हिप के जो ऑस्टियोपोरोटिक चेंजेस होते हैं वो ज्यादा होते हैं, क्योंकि उनको सिटिंग डेस्क जॉब जो होते हैं वो ज्यादा होते हैं, जिसकी वजह से फ्लेक्शन ऑफ हिप ज्यादा देर तक रहता है। उसके वजह से वो काफी देर तक जो ये बैठने की वजह से उनके जो हिप बोन जो होता है वो ज्यादा जल्दी पोरोटिक चेंजेस में चला जाता है। और एशियन वुमेन्स के अंदर क्यों? क्योंकि जो एशियन वुमेन्स होती है वो ज्यादातर नीचे बैठ के काम करती है, जैसे कि बर्तन मांजना होता है या कपड़े धोना होता है, ये काफी सारे जो वर्क होते हैं घर के, वो मोस्टली वो लोग नी बेंड करके करते हैं, इसलिए नी ऑस्टियोआर्थराइटिक चेंजेस वो ज्यादा देखा जाता है एशियन वुमेन्स के अंदर, खास करके हमारे इंडिया के अंदर। Medications, a healthy diet, and weight-bearing exercises can prevent bone loss or strengthen already weaker bone. जैसे कि मेरा ये टॉपिक ही है कि फिजियोथेरेपिटिक एक्सरसाइजेस से ऑस्टियोपोरोसिस को कैसे प्रिवेंट कर सकते हैं या फिर उसको कम कर सकते हैं। There are typically no symptoms in early stages as we perform our day-to-day regular work. We sometimes doesn't feel any type of pain, due to which we won't be able to know that we are suffering from osteoporotic changes or not. There are the signs and symptoms which may be seen after a later stage are as follows: back pain followed by fracture or collapsed vertebra, loss of height over time, as we have seen in first slide, that a woman, when she ages, her height becomes less. A stooped posture means forward bending of thoracic vertebrae, a bone that breaks more easily than expected. Complications: bone fractures, particularly in spine or hip, are most serious complications of osteoporosis. जैसे कि आप सबको पता है आजकल हम सब ये चीज जो है उससे ग्रसित है ही, जाने अनजाने हम सबको पता भी नहीं होता है कि हमको बैक पेन नाम की चीज होती है। अब वो किसी भी रीजन की वजह से हो सकता है, वो डिस्क प्रोलैप्स की वजह से हो सकता है, स्लिप डिस्क की वजह से हो सकता है, इन्फ्लेमेशन की वजह से हो सकता है। आज के दिन जो हम बात करेंगे वो ऑस्टियोपोरोसिस की वजह से। ऑस्टियोपोरोसिस में हमको पता है बोन डेंसिटी, बोन मास जो है वो कम हो जाएगा, जिसकी वजह से पोरस जो फॉर्मेशन है वो ज्यादा हो जाएगा, जो बोन है वो पोरस ज्यादा हो जाएगा, जिसकी वजह से वो कमजोर हो जाएगा। ये जो फोटो है हम देख रहे हैं जिसके अंदर ज्यादा एग्जैजरेट करके बताया, पर इतना सीवियर फ्रैक्चर नहीं होता है। हेयरलाइन फ्रैक्चर भी हो सकता है या ये कॉम्पैक्ट फ्रैक्चर भी हो सकता है, ये कॉम्प्लेक्स फ्रैक्चर जैसे कि इस फोटो में है ये कॉम्प्लेक्स फ्रैक्चर है, ये भी हो सकता है। Hip fractures are often caused by a fall and can result in disability. जैसे कि लिम्ब लेंथ डिस्क्रिपेंसी हमारा एक टॉपिक होता है फिजियोथेरेपी के अंदर, जिसके अंदर एक पाँव जो होता है वो कम हो जाता है हाइट में और दूसरा पाँव वैसा का वैसे ही रहता है, जिसकी वजह से जो इंसान है उसका जो गेट होगा वो लिम्पिंग गेट होगा, जिसकी वजह से वो लंगड़ा के चलेगा। इवन एन इंक्रीज्ड रिस्क ऑफ डेथ विद इन द फर्स्ट ईयर आफ्टर द इंजरी, because due to the femoral nerve and femoral artery are present near the hip bone, which causes the breakage of femoral artery, due to which there will be hemorrhage in hip bone and may cause death within first year of the injury. In some cases, spinal fractures can occur even if you haven't fallen. हमको पता है कि हमारे बोन कमजोर हैं, तो बहुत सारे केसेस में ऐसा भी होता है कि हमने सिर्फ थोड़ी सी मूवमेंट की, ना वेट उठाया, ना जर्की मूवमेंट, ना कोई इंजरी, पर फिर भी स्पाइनल फ्रैक्चर्स पॉसिबल हैं। The bones that make up your spine vertebra can weaken to the point of collapsing, which can result in back pain, lost height, and hunched forward posture. ऑस्टियोपोरोटिक चेंजेस के जो ट्रीटमेंट्स है जो हम फिजियोथेरेपी में मोस्टली पेशेंट्स को सजेस्ट करते हैं, वो इसलिए सजेस्ट करते हैं क्योंकि हमको पता है कि जैसे ही कोई भी मूवमेंट हो रहा है अपने बॉडी में, जिसके अंदर टेंशन क्रिएट हो रहा है, जिसकी वजह से मसल स्ट्रेन या मसल स्ट्रेस हो रहा है, तो उसके वजह से मसल स्ट्रेन, इंजरी वाला मसल स्ट्रेन नहीं, मसल स्ट्रेन एक्सरसाइज वाला मसल स्ट्रेन, जिसके अंदर मसल्स को यूज करना पड़ रहा है, जिसकी वजह से मसल स्ट्रेंथन हो रहे हैं, ऐसी कोई भी एक्सरसाइज हम करवाते हैं, जैसे कि वेट ट्रेनिंग है या बैलेंस एक्सरसाइजेस है या गेट ट्रेनिंग है, गेट ट्रेनिंग के अंदर हम वॉकिंग पैटर्न्स इंप्रूव करते हैं, ऐसी कोई भी एक्सरसाइज है तो उसके वजह से, उसके सहायता से हम बोन की जो ऑस्टियोपोरोटिक चेंजेस है, बोन लॉस जो है वो कम कर सकते हैं और मसल जो है उसको स्ट्रेंथन कर सकते हैं। जैसे however all forms of exercise will help to improve coordination गेट ट्रेनिंग के रिगार्डिंग बात हो रही है यहाँ पे, and keep up muscle strength. This is important because muscles can also become weaker as we get older, and this is a risk factor for falling and therefore for fracture. Walking is a good exercise to improve bone strength, and it is also good for keeping thighs and muscles, hip muscles strong, which is important to help people have good balance and prevent falls. High impact exercises such as skipping, aerobic exercises, weight training, running, jogging, and tennis, etc. games are also thought to be useful for the prevention of osteoporosis. This exercise might not be suitable if you have osteoporosis in severe stages. First of all, let's see spine exercises. In first picture, while eating or cooking, the patient has to be standing in such a position that one block is kept under the one knee, and vice versa. After 5 to 10 minutes, the patient has to change their legs. In second position, the correct posture for sitting is made understood that you have to sit straight and not in crossed leg position. In a working desk position, in sitting while working, you have to keep your elbows on the desk and then work, and also support your knees or hip by putting a block under your foot. In sleeping position, the correct posture for sleeping is to put pillow accordingly such that your spine is in stable position. In lifting posture, you have to carry any of the weight, even if it is 5 kilogram or 10 kilogram or even 50 kilogram of weight. You have to bend down and then lift the object. While driving, you have to keep your hip and spine at 90 degree angle. Some of the exercises in the other picture are strengthening of your thoracic vertebrae, putting a pillow and lifting your spine, stretching your chest to provide thoracic spine stability. In this F number picture, the patient is sitting in stair. पेशेंट जो है वो हाथ और पैर के ऊपर खड़ा है और अपने पैर को ऊपर की तरफ खींच रहा है. In C posture, first the patient has to lie in supine position, bend your knee and then lift your hip. In last picture, same as first, we have done exercises of lumbar vertebra. Now we will perform exercises of cervical vertebra by lifting your chin. Hip exercises. As we have understood earlier that hip is also more prone to injuries compared to spine because of unbalanced diet and loss of nutrition. First photo in hip exercises suggest mountain pose, in which the patient is standing straight and will inhale and then will lift their toes. Second, powerful pose, which is also known as half squatting. Third, warrior pose. In yoga, we can say Veerbhadrasana. In fourth position, half moon position, Ardha Chandrasana. Then in eighth position, the patient is sitting with widen their legs and then touching their knee with head. In seventh photo, the patient slips in supine position and then lifts both the legs in 90-degree angle so that their hamstring muscles is stretched accordingly. Camel pose, we all know. Side planks is performed vice versa, first by right hand, then by left hand. Knee exercises. In this photo, जो पेशेंट है उसको एक्सरसाइज बॉल बोलते हैं, इसको स्विच बॉल जो दिया गया है, जिसके अंदर पहले उसको सुपाइन पोजीशन में सुलाया जाएगा, उसके दोनों जो एंकल है उसके पास में उसको ये एक्सरसाइज बॉल है उसको रख दिया जाएगा, और फिर जो हमने सुपाइन पोजीशन में लेट के ये वाली जो एक्सरसाइज की थी सी वाली, जिसके अंदर सुपाइन पोजीशन में सो के हमने लिफ्ट किया था अपने हिप को, उसी तरीके से इस वाले जो पोस्चर है इसके अंदर हम हिप लिफ्ट करेंगे, पर इसके अंदर जो हिप और नी का जो एंगल होगा वो 90 डिग्री एंगल पे होगा। अब इसमें जो हमने किया है वो दोनों लेग से किया है। सेकंड जो है यूनिलेटरल पेल्विक लिफ्ट, जिसके अंदर एक लेग जो होगा वो स्टेबल होगा और दूसरा लेग जो होगा वो लिफ्ट होगा। तीसरा जो है उसके अंदर बॉल को हम मूव करेंगे, हिप लिफ्टेड ही रहेगा, नी एक्सटेंड और फ्लेक्स होगी। दूसरा जो है स्लाइडिंग एंड स्टेपिंग लंज, जिसके अंदर लंजेस परफॉर्म करेंगे पर जो पीछे वाला पैर होगा वो आगे और पीछे मूव करेगा। जो दूसरा पोजीशन है उसके अंदर पीछे वाला पैर मूव करेगा और आगे वाले पैर से आप नीचे की तरफ बेंड होंगे। और तीसरा जो है उसके अंदर पेशेंट जो है वो वेट कैरी करेगा, वो डंबल हो सकता है या ये एक्सरसाइज बॉल भी कैरी करवा सकते हैं, और फिर उससे लंजेस करवाए जाएंगे। ये स्टेप अप जो है इसके अंदर जो पोजीशन है पेशेंट की वो स्टैंडिंग रहेगी, जिसके अंदर हम स्टेयर क्लाइंबिंग की एक्सरसाइजेस करवाएंगे। और फोर्थ जो है चेयर स्टैंड्स एंड स्क्वाट्स, जैसे कि हमने पहले किया था हाफ स्क्वाटिंग हिप के लिए, वैसे ही हम नी के लिए करेंगे, जिसके अंदर पहले पेशेंट को नी चेयर से सिट अप एंड सिट डाउन वाली एक्सरसाइज करवाएंगे, साथ ही स्क्वाटिंग के अलग अलग तरीके की एक्सरसाइज करवाएंगे, जिसके अंदर फर्स्ट जो है वो नॉर्मल स्क्वाटिंग होगा, सेकंड जो है वो हाफ स्क्वाटिंग होगा, थर्ड जो होगा वो वन लेग लिफ्टेड स्क्वाटिंग होगा, जिसको हम सिंगल लेग स्क्वाट बोलते हैं। एंकल एक्सरसाइजेस, ये जो एंकल टो मूवमेंट होती है जिसको हम एंकल टो एक्सरसाइज बोलते हैं, जिसके अंदर जो एंकल है वो अपनी तरफ लिफ्ट करना और काफ की स्ट्रेचिंग करना, वो जो एक्सरसाइज है वो एक रिलैक्सेशन एक्सरसाइज है, जिसके अंदर हमारा जो एंकल पेन होगा वो रिड्यूस होगा। बैलेंस एक्सरसाइजेस एंड प्रोप्रायोसेप्शन एक्सरसाइजेस के अंदर जो हाफ स्विस बॉल जो है, बैलेंस बॉल भी बोलते हैं इसको, इसके अंदर जो नीचे वाली सरफेस होगी वो स्टेबल रहेगी और उसके ऊपर इन्फ्लेटेड बॉल और बलून जो होगा वो रखा जाएगा, जिसके ऊपर पेशेंट को पहले बैलेंस बनाना सिखाया जाएगा, फिर बारी बारी से एक एक पैर उनका लिफ्ट करवाया जाएगा। एंकल स्ट्रेंथनिंग एक्सरसाइजेस के अंदर या तो आप टॉवेल का हेल्प ले सकते हो या फिर थेराबैंड का हेल्प ले सकते हो, जिसके अंदर आपको एंकल टो मूवमेंट करना है, एंकल डोर्सिफ्लेक्शन एंड एंकल प्लांटर फ्लेक्शन। ये जो फोर्थ इमेज है उसके अंदर पेशेंट जो है वो साइड लाइन में होगा और जो थेराबैंड है उसको नी के पास में स्ट्रैप कर दिया जाएगा। फिर पेशेंट को बोला जाएगा कि उसका जो ऊपर वाला नी है, जैसे कि ये पेशेंट राइट हैंड पे लेटा हुआ है तो लेफ्ट नी जो है उसको ऊपर की तरफ शिफ्ट करे ताकि दोनों नीज के ऊपर स्ट्रेन आए। इसके वजह से एंकल के ऊपर जो है, एंकल के जो मसल्स हैं, जो लिगामेंट्स है, वो स्ट्रेंथन होंगे। एक्सरसाइज टू इम्प्रूव फंक्शनल मोबिलिटीज, ये जो एक्सरसाइज है इसके अंदर हम टो क्लाइंबिंग करेंगे, जिसके ऊपर अंगूठे के ऊपर खड़ा होना और हिल राइज करना, हिल को उठाना, उस तरीके की एक्सरसाइज करेंगे। ये एक्सरसाइज हम मॉडिफाइड वर्जन में जो सीढ़ियां होती है, स्टेयर्स होती है, उसके एज पे भी करवाते हैं। ये जो है एक्सरसाइज, उसको कॉन्सेंट्रिक एक्सरसाइजेस और इसेंट्रिक एक्सरसाइजेस भी बोलते हैं। What can you do if you are living with osteoporosis? Eat healthy diet, take proper medications, perform proper exercises, wear proper clothing and proper footwears. Footwears मैं mostly मेरे जो patients होते हैं उनको suggest करता हूँ कि वो जो पतली चप्पल जो पहनते हैं वो ना पहने, थोड़े से foam type वाली जो slippers होती हैं with acupressure points वाली जो स्लीपर होती है, जिसको ऑर्थोपेडिक स्लीपर्स भी बोलते हैं, वो मैं सजेस्ट करता हूँ। साथ ही साथ अगर लॉन्ग डिस्टेंस वॉकिंग है या हैवी वर्क लोड रहता है या फिर रनिंग या ज्यादा देर खड़े रहने का या कोई भी ऐसा काम रहता है जिसके अंदर वेट लिफ्ट करना पड़ जाए, तो मैं उनको स्पोर्ट शूज सजेस्ट करता हूँ, बेसिकली बास्केटबॉल शूज, क्योंकि इसके अंदर जो आर्च होता है वो मेंटेन रहता है और उनकी जो सोल होती है उसकी ग्रिप ज्यादा अच्छी होती है, वो फिसलते कम है। जितने कम फिसलेंगे उतनी नी इंस्टेबिलिटी और हिप इंस्टेबिलिटी जो है वो कम रहेगी, जिसकी वजह से स्पाइन जो है अपना वर्टिब्रा जो है उसके ऊपर कम प्रेशर आएगा और कम इंस्टेबिलिटी होगी। नशा तो हमको करना ही नहीं है, ये तो हमको पता ही है। किसी भी तरीके का नशा जो भी है, स्मोकिंग है, अल्कोहल है, ड्रग्स है, कोई भी मेथाम्फेटामिन है या ये जो वीड है, ये सब जो भी ड्रग्स हैं उससे आपके बोन डेंसिटी के ऊपर फर्क पड़ सकता है। आपका बोन मैरो जो है वो कमजोर हो सकता है और उसके वजह से आपका जो न्यूट्रिएंट आर्टरी जो होती है, जो बोन के अंदर प्रोवाइड करती है न्यूट्रिएंट फोरामिना के थ्रू, वो कमजोर हो जाएगी, जिससे बोन्स को न्यूट्रिशन कम मिलेगा। Prevent falls inside your home. How? By keeping your floor free of clutter, including throw rugs and loose wires or end cords. Use only non-skid items if you have mats, carpets, or area rugs. Make sure your lighting is bright enough so that you can see well. Do not use cleaners that leave your floor slippery. Clean up any spills that happen immediately. Use grab bars in the bathroom and railings on stairways. Prevent falls outside your home. Make sure lighting is adequate in all areas outside your home. Use a backpack or other type of bag that leaves your hand free. Keep areas outside in good repair and free of clutter. Wear sensible shoes with non-slip bottoms. Thank you.
Excellent, excellent, Dr. Pranjal. What was left, you have covered.
Thank you so much, sir.
It was left and balanced. Now osteoporosis is balanced. Agnihotri, sir. Now it's yours.
Thank you, Dr. Pawanji. I was just waiting for the comments just after our Karthika ji. She also covered the area where which was little bit left by Dr. Sanjay ji. So what I feel now, it is left out has been also covered by our beloved Dr. Pranjal Joshi ji. So his presentation in the form of this exercise session, that was really most informative and very practical. And I am interested to note that how this exercise emanation is being created in a form of this slide presentation. Really, it's just like GIF or something of the sort. So now technology has created so good that persons can very easily understand and can go for their own level exercises so that they can prevent osteoporosis or even otherwise, just to make the body away from the stiffness and rigidity. It's a part of the daily routine. So Dr. Pranjal has contributed a lot. So as per your information, it's almost 8 minutes to 9, and the session is open as the presenters have completed their responsibility. So what I would like to say, as since Dr. Sanjay ji is here, and two things are there in chat box in a question form, which I would like to quote, and Dr. Sanjay ji is here, who would like to say some comment upon it. I don't say that answer, some comment upon that issue. Dr. Hema Malini put forward one issue on in the chat box that as per the Siddha authorities, they say that this old age is having the predominancy of kapha vikara, or kapha means dosha. So how it is going to be related in the form of the vata vyadi? Number one question, and the second one is she put forward that see whether the statin medicine which has been taken by some of the heart patients as per the advised by their physicians may be a cause of this osteoporosis. So these two questions to your very learned means distinguished guest, to please highlight us and enlighten us. Thank you.
Yeah, thank you, sir, for the questions. So as per Siddha, the relation of dosha and the age is opposite to Ayurveda. So it is vata in the young age and kapha in the old age. But if you see the physiological activities that are going on in the human body, it is very difficult to agree that kapha is dominant in the old age. And जस्ट क्वेश्चन पूछा गया है, इसलिए हमको कुछ हाइपोथेसिस बोल के उसको खत्म करने में तो
not like that. If it is not applicable, we are not bound, we are not compelled to say. I don't know whether Dr. Hema Malini is there at present in our platform or not, but what I think
is not there, sir.
She's
not there.
So,
yeah, because
as per the established fact, we all know that
yes,
at childhood it is a predominance of kapha.
Yes,
middle age pitta, and this old age is vata pradi. Everybody very well knows. So these are the established fact in principles. So how Siddha are differing, it is their matter. If our Siddha experts had been here, our any of the this thing, then he would have authoritatively pointed out something. We will be going just for the hypothetical approach. Maybe, may not be.
Correct.
You need not to worry.
Yes,
because you establish your point very confidently, very masterly, so nothing. But as far as the statin is concerned, may statin use be an etiological factor for this osteoporosis?
Yes, sir. Statins are definitely now they have been actually banned, but still in India many doctors are giving statins. Now cholesterol is not a culprit for heart disease. Cholesterol is actually a good thing, because if the sterols are there, then only the osteoblasts are formed. And if we Google by the time that overuse of statin is not good and average use of statin is good for the bone, but I don't agree with this, because statins have been proved to convert the muscle tissue into fat, long-term use. They are not good for kidneys also. And they even hamper with the fat metabolism as well as the bone metabolism. As statins as well as the antacids also, the long-term use and the unethical use of statins and antacids are also very dangerous for the bones. So you should not take statins for a long time.
Thank you, sir. And this is also a very important point. On your this reply, I also encapsulate one more point which you have raised, that as far as the higher stage of say cholesterol, now it is being denied by the UK. US researchers. So it's a great thing that you need not to worry for that, because individually high cholesterol is not causing anything, but taking statin preparation for removal or keeping it in control is more hazardous. Number one, and number two, taking antacids or ranitidine along with the or controlling the effect after effect of this statin, again it's a curse to the physiology of the body. So it's a vice versa. It's a very difficult. That's why we can go for the Pushkar Gugulu in Ayurvedic preparation, so that the heart will be saved and the Gugul will also save the osteoporosis or be helpful for us. So
and
it is
also
a
unwanted fat.
Exactly. So and it also, as it is Palankasha, it will also dissolve the unwanted fat. So with our approach, it becomes a full answer of the both of the questions raised by our one of the audience. Thank you, sir. Thank you.
Full package of treatment.
Exactly. That's why I and you became the complementary for submitting and realizing the today's approach, because Google is always good for the health. Has not got any complication even on prolonged use. And as far as the statin is concerned, it is said by the modern medicine physicians, once it started, you have to go carry on throughout the life. And this is a sort of curse.
Exactly.
So it's much better that you even don't go for equispin, that you have to go for antacid, go for dalchini.
Exactly.
Dalchini and guluchi. This will help a lot. So your knowledge based on Jamnagar, that really appealed me much more, and also it is been shared by all our listeners. Thank you so much.
Thank you very much, sir.
Thank you. Now the session is open, and our guest speakers have completed their responsibility. So let us have any other suggestion, question, or something. And I also appreciate Dr. Pranjal Joshi's approach regarding the management and prevention of not only osteoporosis, but also the joint stiffness or backbone problem or any deficiency of calcium. With the increasement of the circulation in general, it will help. So I would like to, before I ask the namely, I would like those who are there in our say platform by now it is 16 persons available. So I think any of the person interested to add on something or have got some doubt or suggestion, please come forward. Madam Palu Joshi is still with us, and I congratulate on the
मैं बोलना ही चाह रही थी कि मुझे कुछ ऐड करना है, क्योंकि मेरा जो सब्जेक्ट है ना उसके ऊपर तो कोई नहीं बोलेगा.
I am saying something different. I am going to say that being a regular and reserved persons, I was just going to name you. And first of all, I would like to congratulate you again for the nice presentation of your son, our master, Pranjal Joshi. As I told you earlier, we have got Dr. S. Joshi, and he has got one son, and his name is also Dr. Pranjal Joshi, as he is MBBS. Yes, ma'am, please continue.
सर मैं ये कहना चाह रही थी कि भारत देश में we have enough sunlight, so we actually don't have problem of vitamin D, but this AC culture and this flat system has brought everyone inside the house, and so they stay away from sunlight. तो प्रेस्टीज सिंबल हो गया, काम वाला होना ही चाहिए, इसलिए फिजिकल एक्टिविटीज कम हो गई है और उसकी वजह से काफी सारी दिक्कतें खड़ी हो रही है. तीसरी बात जो थी वो सोशिएबिलिटी. व्यक्ति अगर सोशिएबल है तो उसकी चीयरफुलनेस बनी रहेगी और वो ऑस्टियोपोरोसिस से उसको बचाएगा. दूसरी एक बात जो साहब बता रहे थे संजय साहब, उसमें एक्टोडर्म, मेसोडर्म और एंडोडर्म जो है उसको हम व्याधि के बाह्य रोग मार्ग, मध्यम रोग मार्ग और अंतर रोग मार्ग ऐसा क्राइटेरिया फिक्स हो चुका है. तो इसके मुताबिक हम चले तो ये बराबर फिक्स होता है. और वो हम सब ध्यान में रखे कि बाह्य रोग मार्ग जो है वो जर्म लेयर जो एक्टोडर्म है उसमें से, मध्यम रोग मार्ग है उसको मेसोडर्म से, और एंटोडर्म जो है उसको अंतर रोग मार्ग. ऐसा करके हम अगर इंटरप्रेट करें तो बहुत मदद मिलेगी. दूसरी एक बात जो मैं कहना चाह रही हूँ कि गर्भ के अंदर बताया गया है षडात्मक, यानी आत्मजश्चयम गर्भ, मातृजश्चयम गर्भ, पितृजश्चयम गर्भ, सत्वजश्च, रसजश्च, सात्म्यजश्च. आत्मा जो आया अपने कर्म लेके आया, उसके मुताबिक उसने माता पिता को चुना. उन माता पिता ने जो कुछ किया है वो उस गर्भ के पूर्व जन्म के कर्मों के मुताबिक ही उनको मिलेगा और उसके मुताबिक ही इस शरीर को जो अब गर्भावस्था में आके फिर शरीर धारण करेगा तो उसको वे व्याधि होंगे। इसलिए माता पिता को दोषित मानने के बजाय हम अपने कर्म को ही संभाले तो काफी मदद मिलेगी, क्योंकि आचार्य ने बाद में बताया कि सभी रसायनों में श्रेष्ठ जो है वो आचार रसायन है। हम कितना भी अश्वगंधा खा ले, लेकिन अगर मेरे दिमाग में यही चल रहा है कि मैं इसको उठाऊं, इसको गिराऊं, इसको मदद करूं, इसको बीच में आ जाऊं, ये अगर मेरे दिमाग में चलेगा तो मुझे ऑस्टियोपोरोसिस बिल्कुल होना है। लेकिन अगर मैं बोलूंगी बच्चा तुझे मदद चाहिए, ले ये मैं मदद कर सकती हूँ, या फिर इसको ये मदद चाहिए, देख लिया और मदद कर ली, नेकी कर समंदर में डाल इस तरह, तो अगर मदद कर ली, दैट इज गोइंग टू बूस्ट द ओज, और वो प्रतिलोम पोषण भी होगा। तो ये बात दिमाग में रखने की मुझे थोड़ी जरूर लग रही है। और लास्ट पॉइंट जो है वो आम अवस्था में कोई दवाई नहीं दी जाती, क्योंकि अगर हमने बस्ती दी आम अवस्था में तो इंटेस्टिनल विलाई उसको एब्जॉर्ब नहीं करेंगे। और आज के समय में मात्रा बस्ती के बजाय इनके ये जो है इसमें योग बस्ती जो है वो काफी मदद कर रही है। हम लोग जो है वो योग बस्ती देते हैं, और वो मैडम जी बहुत बढ़िया बताए कि 18 to 20 years की बच्चियों में अगर ऑस्टियोपोरोसिस मिलता है, उसमें हम एजिंग चेंजेस कहाँ से लाएंगे? वो तो बच्ची है, अभी उसको मेंस्ट्रुएशन भी ठीक से नहीं हो रहा है, ओव्यूलेशन भी ठीक से नहीं हो रहा है, उसका ग्रोथ अभी बाकी है। ऐसे बच्चियों में अगर ऑस्टियोपोरोसिस मिल रहा है तो इट्स एक्चुअली बिग डेंजर सिग्नल। लाल बत्ती बराबर बनी है, सभी को सावधान होके इस दिन का महत्व समझ के आगे बढ़ने की जरूरत है। Thank you so much, Pawan sir. Thank you so much, Agni sir. And thank you everybody for giving me a chance to speak on this platform.
Thank you, madam. Thank you so much. I was just waiting for your comments. And really, you, as you are masterly approaching on the issue of embryology, Garvavaktanti, teratology, and again, you carried today's problem to that extent also. Again, as on this submission, I just capsulated the matter which was raised by Dr. Sanjay ji, as he told that the same mesocolon is developed by the help of the embryonic membrane as far as the Asthi Dharakala is concerned, and so is the Purish Dharakala. This is that linking. And as you told about the vitamin D deficiency or sunlight, I am also having one memory in my mind that a girl suffering from IBS was by treatment, that too online. And when I asked simply just to get up and start giving Surya Namaskar and Surya Argha, she surprisingly told that from where we will see sun. I have never seen. I've got such a hopeless dinacharya that I leave because I am residing at say 3rd, 4th, 5th floor, and when I leave the residence at early morning, sometimes it is impossible, and when I return back again, sun is not there. Then in what way the life is going on, that too in the MNC workers and all that, and the reality is in hand that they can go for the Osopon tablets and all that, but direct synthesis with the help of the sun rays is next to impossible into their life. And the thing which you told that any amount of ashwagandha or rasayan will not going to help in any way if the mental status is not kept cool. And I am still remembering your one sentence also, that that couple started giving almonds and walnut just to keep peaceful the mental status, and the anxiety, the worries, the fearfulness, and the angriness, these all warded off from that mental status. That can be put again in the same manner. So these are all the real and natural sources of all our requirements of the body and blood and bone, may it be calcium, manganese, phosphorus, copper, everything is there. So thank you so much for your inputs in our today's webinar. And I would again like to invite our good friend, whosoever is interested to put some input, something. And moreover, while they are deciding to do something, again, I would like to take a few minutes for Dr. Sanjay's presentation as reserved, that whatever he heard in our today's webinar, would you please like to say some feedback of overall going through the say presentations of the other person apart from you as a guest speaker?
Yeah, definitely, sir. It will be a pleasure.
Yeah. Thank you.
Yeah. It will be a pleasure because it is a good thing going on. What we are, it is an integrated approach. Because I was about to tell that what Dr. Pranjal did.
As far as my moderation is concerned, I am always interested that those who have started and the person who has started in the first, he must be given at least 2 minutes for, if he remains up to the end. The problem
Exactly.
is that our speakers usually leave the platform, so that becomes a difficult. You are always with us, and you have answered the questions put in the chat box, and again you are here to give something in as a feedback. Thank you so much.
Yes, sir. Yes, sir. So Dr. Karthika was excellent in her concepts because we, the Jamnagar School of Ayurveda, will go with more Charaka view of you. And as she is from Kerala, she covered excellently what topic I left from Ashtanga Sangra and Ashtanga Hridaya. So that's why I said it's an integration. And we know that Avyayama and Ativayama both are not good for osteoporosis. And I would like to heartily congratulate Dr. Pranjal Joshi, who has excellently, with the nice slides, with animations and all, he gave a very excellent lecture for all the viewers who are also watching on Zoom or YouTube, that if they practice at least this Surya Namaskar and some of these exercises, what he has told, and they are not that hard also, they are very simple sitting and sleeping exercises, which will definitely build the muscle mass, and also indirectly, it will be directly helping on the bones to be getting stronger. And I should really congratulate Madam just who spoke, Dr. Parul ma'am, because I can understand the wisdom in her that whatever you take Rasayana, the most important thing is the positive thinking and always the peace of mind, as well as we can say that Atadbhuta Dayam Prati. That means we should always have a positive thinking. In Charaka 25, he says, Anirvedo Varta Lakshananam. That means you are not complaining and you are not having any negative thoughts. That will definitely initiate more positive energy in your life, as well as no need of taking any Rasayana. Charaka and Achara Rasayana says that if you follow these things, Satyam, Adinam, Krodham, etc., at the end he says that आपको किसी भी रसायन की लेने की जरूरत नहीं है, सिर्फ ये करने से सभी 4 चैप्टर में जो रसायन का बेनिफिट बताया है वो सिर्फ आपको आचार रसायन से सब कुछ मिल जाएगा. So this every treatment Ayurveda, we are blessed that what Madam said, Parul Madam said, that there should be a spiritual touch for everything. And heartily congratulations to you, sir. You are doing a wonderful job because you are collecting all the great minds from different parts of India, and actually the listeners are very blessed that different topics and everybody is giving their 100% for development of the science. This is very good thing.
Thank you so much for collecting the high class mind and making a ring of that. If we need a small mind also. So talking and dealing with the Jamnagar alumnus at international arena, it really becomes a responsibility and pleasure both. So thank you so much. And I think if I just enumerate the names, those are there in the platform. Any our respected guests who are interested to say something, right? I was very much interested for Jayesh Thakkarji, though he joined and at very early stage. Now he is not available. So Dr. Leena, Dr. Midulata Maurya, Dr. Suma Kaggal, or Dr. Shiv Kumar Yaragal, etc. And anyone of is interested. Otherwise, I would like to have our blessings from our very senior and respected Dr. Jagdish Domaji. He is with us. So if other person, none of is interested to add on something or put some suggestions, our respected Dr. Jagdish Domaji, I request you please say some blessings for today's webinar. Thank you so much. Namaskar. Namaskar, sir.
Should I add?
Yes,
Agnihotri,
yes, yeah,
namaskar.
please, namaskar, sir, namaskar.
Have to, though I didn't go through all the lectures because interruptedly
Yes.
I was just listening. But here, in case of osteoporosis, what we are dealing with the subject today, usually at the same time, contemporarily, when we ask and we say, usually I come across the patients who are suffering from this disease very, very, that means ignorantly, that whenever they need in village side any problem of muscular pain and all those things, immediately they go for Overon. Frequently, I used to hear from them. Overon is a combination of diclofenac sodium. Continuing and irrespectively consuming Overon, they themselves, modern medicine people, they themselves tell that it is a very dangerous one. But it is quite nicely available at the counter in the villages also. Even Kirana shop people also used to dispense. In a village where I took birth, there also they are just dispensing. Dispensing means a Kirana shop, Overon is available. It is very dangerous. Ultimately, it leads to osteoporosis, consuming frequently. And at this juncture, people of at least village side do think that taking mooli is better to preserve the calcium, or at the same time, Jamaican is better to keep the health Vatahara. This has not been inculcated in the minds of the people who are just acquainted with the agriculture. If this would have been, I say that taking modern medicine irrespectively and without no prescription also, it's a very dangerous. That is why we are facing so many problems from this side. Of course, if this is not the subject including in this, I give you a reference that there in government hospitals, a section or a hut in our government hospital, district hospital is created for a medicine which is served by foreign company for uterus cancer, freely available. But there will be no board, nothing and everything. Only the patients who are coming to know that it is freely distributed. There, the trials will be going on, and the supervision and dispensing person who there will be means he will be a BAMS part. Do this BAMS boy know about the medicine which is dispensed by the foreign company? No, simply serving that medicine as a compounder. On one occasion, when we were discussing about this subject, here in that dispensing counter medicine, there some nursing girl was there. I asked that, Anuradha, why are you here in the government hospital? Then यहाँ पर जो है ना वो सफेद वाले व्हाइट पीपल का माने फॉरेनर्स का यहाँ पर यूट्रस कैंसर का मेडिसिन देते सर, मैं नर्स काम कर रहा हूँ, कितने दे रहे हैं? 2500 दे रहे हैं। अच्छा ठीक है। तब यहाँ पर कोई रहते हैं वहाँ वो जो तेलदोरलू बोलते हैं माने व्हाइट पीपल, हाँ वो लोग कोई रहते हैं? कोई नहीं रहते है सर, हमारा ब्लैक पीपल ही रहते हैं। तो डिस्पेंस करने वाला कोई है? कोई नहीं सर, एक रहता है डॉक्टर जैसा, वो ऐसा बोल रहे थे। नो क्वालिफिकेड नथिंग, but only the free distribution of that medicine. About the fate of the medicine, I am coming to discuss. In the meanwhile, a medical representative, very oldest company, I say in Andhra Pradesh area, PC Ayyavarappaya, their son, that means granddaughters are given to, they are putting up very big companies now. But whereas PC Ayyavarappaya now, he is no more now, and his company was also very reputed in AP. Now it is being handled by an adopted grandson who is not qualified BAMS and is the MBA, and he gets much income from tobacco lands. That is why he is the least bothered about the company, and the company is due. like this, of course, whatever it may be going on. But there I am telling that in the meanwhile, we were discussing with the representative of PCI and company. PCI and company representative Muralidhar Rao says, sir, in Macharla, there was a BAMS boy who is supervising this thing, American medicine. In the meanwhile, 3 people died in a week. And immediately that BMS boy ran away from the clinic. Why? Then I put a question to Muralidhar Rao. Muralidhar Rao garu, क्यों वो भाग गया वो लड़का बताओ? पहले जो है ना, अगर 3 लोग मर गए बोले तो पुलिस वाले आएंगे, जो काउंटर पे रहेगा उसको हाथ कड़ी डालेंगे. वो तो अमेरिका वाला, वो कहीं रहेगा, वो क्या पैरवी कर लेगा उसके बाद की बात. पहले तो इसको हाथ कड़ी डालेगा, इसलिए वो भाग गया. उसको देते थे कितना, आप ही बोल रहे हैं 6000. बीएमएस बॉय को 6000 देते थे, वो ज्वाइन किया वहां पर. इन व्हाट वे दिस बीएमएस बॉयज आर ज्वाइनिंग विद द डिस्पेंसिंग सेक्शन ऑफ दैट मॉडर्न मेडिसिन ओनली फॉर इनकम. And at the same time, let us think a high level, how this country allowed that nonsensical medicine to try on the citizens of India. How dare to? This is going on because they cannot conduct. They cannot conduct this trial in their country. That is why they try on such countries where they make a trial and get the data collected. Because there is strict rule in America. It cannot be unless until it is proved safe, then only they will allow. That means for trial also, are we animals? Like
Sir,
it is going on.
really, sir, thank you so much. You really raised the very important point. And that that we got your point that indiscriminately medicines are given. If they are given free of cost, we are being utilized and our centers are utilized. That is bad. But at the same time, these medicines are leading to ultimately osteoporosis or such damn thing like use of the boveron in form. And again, so many medicines are there which may be responsible for the calcium depletion. Reality, they are also making the bones porous. So in the same manner, it is very wiseful that let us see that which of the medicine, if it is of no use, may it is available in Pansari shop, Anandika tablet, Ceridon tablet, or aspirin tablets. Every misuse of such medicines, simply because these are available without prescription, very low cost, they are damaging the whole of the body in any way of any of the system. So you very rightly raised this point, and we think that
Agnihotriji, little bit I am just bringing to your notice.
Because we are just going to close, and we are all having very tight schedule nowadays at the festive season. So I think all the concepts have come. So yes, you please.
At the closure only, I will be called. Agnihotriji, at the closure only, I will be called on. And putting him in a
no. You take your time. You take your time. But your concept.
I'm not interested to entertain also, because only the conclusion I am bringing to the notice of the audience that for a cardiology specialist on Dial Your Doctor program, he says that animal fat is clarified butter. Ghee जो है ना animal fat बोलता, और जो है वो जो है prohibited है cardiology specialist के लिए, ताकि वो जो है ना एस्पिरिन देते तो जरूर, और उसको मारने, उसको घटाने के लिए एंटासिड देते जरूर, वो भी काम नहीं करे तो हाथ उठाते जरूर. लेकिन कोई उल्लू का पट्टा, मैं बोल रहा हूं करके ऐसा मत बोलिए कि कोई उल्लू का पट्टा ये नहीं बोलता कि घी खाना ठीक है. नहीं, घी खाना खतरनाक है. ये कोई बात है? अपने पास अर्जुन ग्रुप में अर्जुन ग्रुप.
Sir, I would like to say one very important thing, as you told, with all my folded hand, and I'm sorry if I call you at a very early number on the starting of the discussion. You know what will happen? The major time will be taken by you, and our youngsters, those who are enthusiastic to add something, they will either suffer or they will leave the platform. That's why it's not a matter that I call you at the last. I call you then when I feel that total collection of the thoughts of everyone has been there in your mind, and now it will be a super nutrient matter which will be given by you. So I am very thankful to you for adding on all these such type of things, and I think the time is up to return back this platform to Professor Pawan Sharma ji, so that he would like to finish it, complete it. Thank you so much. Thank you all the participants, especially Madam Parul Joshi ji, Dr. Sanjay ji, our Dr. Jagdishwar Doma ji, all the well-wishers and those who have contributed by their knowledge to this platform today evening. I am thankful. So, and over to Dr. Pawan Sharma ji. Namaskar.
Thank you. Thank you. Thank you very much, sir. Thank you all. Tomorrow we will be meeting to evaluate the entries of Dhanvantris to the competition. So please do join at sharp 6:50. Tomorrow will be semi-final of that competition. Thank you. Thank you very much. Good night
Thank
to
you.
all.
Thank
Good
you.
night,
Good
Dr.
night. Namaskar.